during the interim. Commissioner Rowland, do a mic check.
Mic check.
Great. All right, 7 o'clock. We'll call to order the Board of Commissioners meeting for our June 7th, 2022 South County Fire Board of Commissioners. If you have those at headquarters, please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Moving on to approval of the agenda. Do we have a motion to approve the agenda?
I move.
Mr. Teoflack,
Second.
second on the motion. Commissioner Daniels, any discussion on the motion? Seeing none, all in favor say aye.
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 Great, motion carries. Moving on to our consent agenda, items 4A through 4E, the claims, vouchers, and healthcare EFTs. We have a motion to approve.
So move.
Commissioner Daniels, do we have a second on the motion?
I'll second that.
Commissioner Chan, any discussion on the motion? Commissioner Kennedy.
Yes, thank you. Chief Hovis, I want to thank you for your answers to a few of my questions that I had last night about the vouchers. I did have a follow-up for you on the one related to the Linwood red light traffic infraction, which is located, sorry, it's at page 24 of 76. It's Linwood violation process 11723. $124 red light violation. For red light violations, or sorry, for traffic infractions, it got me thinking about traffic infractions and our on-duty vehicles. You are empowered to drive via your license with the state of Washington, although you are driving on behalf of South County Fire. Why is South County Fire responsible for the infraction as opposed to the driver?
It's a good question. I know sharing, my daughter's not watching this, but sharing my daughter Kelsey's first experience going through a red light camera in Linwood doing a similar thing. It was actually the registered owner of the vehicle, which was me, that received the violation and had to pay the non-moving violation, even though she was clearly the driver at the time and still lived at my home. So it actually went to me as the registered owner, as the registered owner of the vehicle. I'm assuming the same would apply to a government agency or a corporation or those entities. But that's a good question. We can follow up with. I know we have Rich Davis here today, but maybe follow up and get some more information on that and see what that looks like.
Because I actually haven't seen this issue before, which is an infraction while on duty, and it got me thinking about, well, you know, it's one thing for on duty. I mean, that's not great. Of course, we need to take responsibility for it. But, and I'm glad to see that the employee was counseled because we want to obey the red light cameras and red lights in the city of Linwood and everywhere. But it got me thinking about, for example, vehicles, as an example, chief vehicles that are 24 hours a day, as long as they're within reasonable driving distance of the South County Fire, both for personal and for business related reasons, and an infraction is received. Who pays? Is that the employee or is that South County Fire? And I didn't have an easy answer to that question. I haven't actually seen it before. So I was just kind of curious in this context, which is slightly different with the red light camera, as opposed to say a speeding infraction,
Right.
Or negligent driving infraction, something like that. Who ends up paying? And also then I kind of had a personal wrinkle to that, and that is very occasionally I will drive on behalf of South County Fire to a conference or something, to meeting somewhere, and if I get an infraction, does South County Fire pay for my infraction if I'm operating on behalf of South County Fire? I actually didn't know the answer. So just kind of curious. I was curious if you knew off that top of your head.
No, if we were over in Chelan, we could probably ask Nicholson Insurance too, or carrier under VFIS. But as commissioners, we're all covered as staff or elected officials underneath that insurance policy, which includes auto. But that's a good question. So I'll do a little bit of research and see if we can find out more. We don't see these very often, and sometimes, and I'll just say this, commissioners, an outstanding employee that owned the situation, and I'm sure that won't happen again. Sometimes bad things happen to people. I'm hoping I don't get one from going through the intersection of 168th and Highway 99 soon, because there was a vehicle with someone that's a little bit older that was having some traffic navigation issues and started to stop in the middle of the intersection almost, and got me in the middle as we turned yellow to red. So those things happen. I know the city believes in red light cameras to keep especially the areas of the school zone and those high traffic areas down, to keep really pedestrians safe that are going through crosswalks. So everything I relayed in that email, I know they felt it, and that won't happen again. So we'll do some research, and I'm interested to find the answer myself. So thank you.
Sounds good. I did have one other follow-up question for you off of my questions that I sent to you last night, and that relates to the airfare seat upgrade, which is at page 26 of 76. Of the packet, item 9858, 1 May 22 and 2 May 22, to the rail rescue class. And the rail rescue class, is that in College Station, Texas?
I believe so. I just asked Chief Isatilla. We don't have Chief Wells today, but I believe that is what Chief Wells had mentioned to the commission previously.
Okay. The closest large city and airport to College Station, Texas, I'm not very familiar with Texas, is Houston, although you could also possibly fly through Dallas to get there. The $867 for the base ticket is quite expensive based on my limited research, but I don't know enough about airline tickets to say that that's extraordinary, out of bounds. But particularly in the context of where these two were situated with each other, and the $126 upgrade definitely caught my eye. And you might guess what I was thinking. I was thinking that's a first class upgrade. And so was that an upgrade to first class?
No, and thank you, Commissioner Kenny, for asking the question first, because it gave us an opportunity as staff to think about where airlines are now with, there's different economy, there's business, there's coach, there's first class, there's a lot of different things. And I think we're going to take the opportunity here with CFO Bothwell and ACI's Taylor to look at that and make sure that we're doing things appropriately and have the right people in the right seats. Fortunately, that flight was changed for Captain Bowden, and that upgrade was for leg room based on being against a bulkhead. He's a very tall individual, but because of the change, that is getting refunded to the RFA. He's still going to get the training, still going to be able to come back and be our subject matter expert. And I think I used an abbreviation in that email, but that's what SME is, but be able to teach all of our responders, especially our technical rescue team, what all these intricacies that we'll see with Sound Transit 2 coming to Linwood in 2024. But it was not a first class upgrade. Airline prices, I agree. I'm not an expert, but and watching the news, we're in such an inflationary economy, and with fuel prices, it is getting expensive to travel, especially with the volume of travel right now.
Okay, and I don't know enough about it to say, like I said, that's out of bounds. But but my expectation is, and I believe our policy provides for it, although I couldn't put my finger on it easily before the meeting, is that South County Fire employees traveling on, at our behest, do not travel first class at our expense. Is that your understanding?
That's my understanding. I've
Okay.
been on a few trips, not too many in the last 28 months or so, but
Sure.
I will say that I have never flown first class. I'm not familiar of any of the other chiefs going to conferences or staff in other organizations either, but yeah, that is affirmative.
That
No
sounds
first
good.
class. Okay.
Great. Thank you, Chief.
You're welcome, sir.
Commissioner Chan?
Yeah, well, thank you for Commissioner Kenny kind of go into detail on that. I can just, from a private operation policy, number one, on the infraction, usually when I go speeding on the company car, I probably get a ticket right there by the officer, and I will pay that as quick as possible. And I don't even want to let people know on that, even a company car, because it is embarrassing and it is all that. So, but red light is really different issues. And I know Linwood is really sensitive and they got a lot of revenue on that. Even on the right turn, you're lowering, they consider that. And unfortunately, I tell you, I completely slowed down in Linwood, and my accident, probably know that it was yellow light. I don't go through Linwood at all. So that is something I think is good to study on. The second thing on the policy on the flying, and that's for my corporate issues. A lot of time, we do not say, well, if you're tall, then you get upgrade, or if you're short, then you stick under code. That is not how policy works. Now, you usually ask for aisle, that type of thing. But on the international flight, we do have the situation as a long way trip, we allow some of the people that to upgrade it in a little bit aisle seats. And right now it's complicated. Now the airline have the exit, they charge you more, economy plus and all of that. I'm not saying defense of anybody else. I'm following up. Yes, because of the COVID, now a lot of the airlines, they are really short of pilots. And Alaska, the situation, the airfare has crazy gone up quite a bit. And so that is something to consider. But I agree, I think it's a really good time for us to review our policy. And because it is public money, so we got to be careful. We don't want to get out to the press. That's my comment.
Chief Isotelo, so if that other infraction does show up in the mail, I assume you're prepared to counsel chief? And if so, could you record that as a training tool for the rest of the staff?
No. It's, if you know driving, there's no training for
I
rolling
know, Commissioner
stock.
Chan, just being lighthearted. Anything
Okay.
else on the consent agenda? If not, all in favor, say aye.
Aye.
Motion carries. Moving on to approval of our meeting minutes for our May 10th and May 17th meeting. A motion to approve. Commissioner Chan,
I like to separate the two meetings because I was not present on the 17th.
so you're asking to separate the two in
Yes.
two different votes?
Yes.
All right, we'll go ahead and take them one at a time then. So approval of the May 10th special meeting. We have a motion to approve. Commissioner Daniels, we have a second on the motion. Commissioner Kenny. Any discussion on the motion? All in favor, say aye.
Aye.
Motion carries. And do we have a motion to approve the May 17th meeting minutes? Commissioner
moved.
Kenny? Do we have a second on the motion? Commissioner Daniels? And any discussion? All in favor, say aye.
Aye.
Motion carries 6-0.
Abstain.
6-0 and one abstention.
I'm sorry, Commissioner Rowan, were you attending? Because when I look at the video, I did not see you on the 17th.
Yes, I did attend. I just wasn't on, I didn't have my camera on because that was around the time that I came down with COVID, so.
Oh, because I read the minutes though, it's okay.
Yep.
All right, okay, thank you.
All right, moving on to public comment. If we have anybody on the call wishing to make a public comment, please use the raise your hand function. You'll be elevated to the meeting to make a comment. Looks like we've got 11 people on the attendee side. Seeing no hands raised. Close public comment. Moving on to our fire chief report with Chief Hovis.
Thank you, Chair. Good evening again, commissioners, staff, presenter guests tonight, and meeting attendees. Commissioners, I've emailed you an update for South County Fire related to the COVID pandemic and our first watch operational report. So we won't be including that presentation tonight or those metrics, but I do have 4 updates for you. And Lori, if you would be so kind to start the PowerPoint. Great. So want to share with the commission this picture of the Snohomish County District 3, what they're calling Recovery Roadshow, to talk about distributing funding throughout communities from the county. We had an informational table there at the District 3 Roadshow, which was held at the City of Linwood Library last Thursday evening. About 100 people attended the event, and it was really held to get the public's input on spending those recovery allocation funds. Attending from South County Fire were Commissioner Daniels and community resource paramedic Jeanette Anderson, as well as community resource paramedic Jared Vosberg. And you can see Shawnery Guzman, our outreach manager, ACT coordinator Laurel Sprague was also in attendance with PIO Leslie Hines. Next slide, please. Commissioners, want to let you know that recruit class 2022-2 started employment with South County Fire this week, and this was their second day with us. We have 16 new recruits in this class, and that picture is from today, and they will really begin their formal fire academy training on Monday. Commissioners, a reminder, these are lateral firefighters. The 16 bring 75 years of combined experience with other organizations. Some are originally from this area and returning back again. It should be a good group, and we're excited to welcome them. And you will be meeting them at the swearing in ceremony to be held at our third meeting of the month. Next slide, please. Recruit class 2022-1 is now on the street. So our graduates from that academy, they've wrapped up their post-academy training. Their post-academy EMS academy was last week, and they are in the fire stations now this week as new probationary firefighters or probationary firefighter paramedics. And the last picture we'll have is of a hazardous materials response that happened on Saturday. Just in summary, it's a 3-alarm event. It's been covered in the media. It was at the Extended Stay America, also in Linwood, the 3000 block of 196. The housekeeper reported seeing something suspicious, and what that means, if it's hazardous materials, we had units and personnel from South County Fire, as well as Everett Fire, Snohomish Regional Fire and Rescue, and Marysville Fire respond to assist our crews. The hazard was isolated and the scene turned over to Linwood Police for further investigation as a crime scene. And with that, thank you for the opportunity to provide my fire chief report this evening. Staff would welcome any questions from the board.
Thank you, Chief Ovis. Any questions, comments? Commissioner Kenny?
Yes, Chief, I wanted to ask a question off of your written materials you sent out about coronavirus. In particular, you had other materials in there, but I had a question for you. You have, for a number of these reports now, indicated that our uniformed employee vaccination percentage, which I want to say was 93%, this doesn't indicate, but I think it was 93, has not changed. And that's been the indication now for many meetings, many updates. And I was curious if we are changing the definition of that from just getting your 2 shots if you're Moderna or Pfizer, or your 1 shot if you're Johnson & Johnson. Are we changing that to then include being boosted once, or we're starting to enter the realm of boosted twice? Are we changing that definition, thinking of changing that, or are we just leaving it as you're considered vaccinated if you've had the two initial shots, shall we say it that way, or the 1 initial shot on Johnson & Johnson?
I think it's a good thing to think about, and I'll just talk about myself. You know, I was double vaxxed, boosted, and still got COVID. I haven't got the booster, although I'm over age 50. So, you know, at this point, as we know, commissioners, the governor's proclamation and what got us to that original 82% and up to 93%, and being able to retain all of our workforces based on that governor's proclamation and the Department of Health recommendation. At this point, there's been no change to that proclamation to rescind it, end it, or to add additional vaccinations to include boosters. So I haven't heard of no other agencies, fire agencies, making that change. And obviously we do have a memorandum of understanding that covers that with our union employees, uniformed employees that fall under that proclamation. I'll just say, as I have said for many, many weeks, please do everything you can to avoid COVID, and especially that fifth wave really went through our communities and our workforce. If you are eligible for a booster, I think that you should get one, but at the end of the day, we can only require the 2. But I like what you're thinking about, because I think this is going to become, eventually endemic, and we'll see what happens with our workforce and then also in the community. So with that, that's what I have, Commissioner Kenny.
And kind of a follow-up to that, Chief, I know we kept data, and that's how we know the 93% regarding the 2 initial vaccinations. Are we keeping data regarding the boosters, or do we not have that data?
Some employees have voluntarily offered that up. Obviously, we have our boosters that we've offered as well. So when we know our employees have gotten it from us, yes, but there's no requirement to provide that to the, us as an employer, or even to their primary care physicians they may have, or anything else. I do see a lot of people now seem to have it on their iPhone, especially when those times where they needed to get into some place in, say, the city of Seattle or King County. And so we do know very well who has 1 J&J, 2 Moderna, or any of the other vaccinations. But as far as boosters go, it's limited at this point.
Okay, I can just see that definition of what's fully vaccinated changing perhaps as we get to the fall or maybe next winter. And I just was curious if we were thinking about that, but I understand the tensions involved. Thank you.
Thank you.
Any additional questions, comments for Chief? Commissioner
Sorry,
Kane?
sorry, I had one more question. Chief, at the last meeting on the extended agenda was fireworks for today. For some reason, fireworks is not on the agenda today. We talked about talking about fireworks today, and it's been 3 weeks since we last met. So I wanted to ask about fireworks and a fireworks update, particularly around the Snohomish County Sheriff's Office. We're less than a month to the 4th of July. My guess is the Sheriff's Office is making its schedule or has already made its schedule for the 4th of July. Where do we stand, particularly regarding sheriffs and any other updates on preparations for 4th of July?
Commissioner Kenny, commissioners, you will see an update in a forthcoming meeting to be next Tuesday to give that. I don't want to take away all of Chief Fitzgerald's audio time next week, but the reason why you didn't see it is because we hadn't got an answer back from the Sheriff's Office on what we needed to know. We now have that, so you'll have that in your packet and presentation next Tuesday. Does that help?
You're not, you don't have a big smile on your face, so I take it that's probably not good news.
Oh yeah, no, you're reading my body language for sure. So yeah, and that's, I couldn't make the packet, and so
All right.
Can't make the packet. Well, we've worked together before. Yeah, you read that. So, but we will provide an update and next Tuesday.
Commissioner Kenny, if you'd like an indication of probably where that's going, go look at the Snohomish County Sheriff's Facebook page. They had an announcement of essentially taking out a lot of specialty units and just putting them on patrol just to meet bare needs. So I think that's foretelling of what we'll hear next week.
Sometimes when you're bringing overtime dollars to the table, money talks, but I understand.
Commissioner Cham?
Yeah, I think I know that I heard that you don't get any answer from them. I think in Snow 911 on the finance committee, I used to work with one of the deputy sheriff. Maybe I'm just suggesting in the future, if you don't get any answer, that might be using a elected official, put more pressure on. I mean, that might be helpful. I really I understand the agency. Sometimes we may have to go in that way. I guess I'm kind of person that I do not accept no response. I'm just suggesting. I don't know, was that proper way? I don't know. You probably know, but being an official, we're not afraid of offending people. You work those people. You need to be careful on that relationship. I'm just suggesting, would that be appropriate in the future?
If former Undersheriff Baird you're referring to, Commissioner Chan, I'm not afraid to, I wouldn't want to insult him, but sure not worried about offending him. He's retired now, but the new Undersheriff has been as responsive as he can be with Chief Fitzgerald, and that he is our primary point of contact on this issue. So we'll be continuing communications with our valued partner, Snohomish County Sheriff's Office, and the sheriff himself and the undersheriff, and we'll have a full report next Tuesday.
All right, thank you.
Thank you.
Any additional questions, comments before we move forward? All right, thank you, Chief. Moving on our
Thank you.
agenda to item 8, our legal report with Rich Davis.
Good evening, commissioners. Interesting day in Bellingham. I represented fire departments for about 30 years now, but I don't often see firefighters in action. And I came back from lunch today to find a car ablaze right behind our office, and local Bellingham Fire Department sprung into action. And it was interesting to watch and extinguish that fire. The car pretty much done for. But in terms of legal report, things that we've done past month, contract review. We have assisted employees who have been slated for providing testimony with legal actions that are not involving the RFA, but involving third parties. We've assisted staff in preparing some templates for standard responses when our personnel have been requested to provide that testimony, so that we have templates that can be issued without contacting our office every time that happens, and with a particular emphasis on protecting protected health information. And then we've responded to a variety of questions from staff over the course of the last month. Not too much going on the legal front. There is just a reminder on Senate House Bill 1701, which is the update to LEF 2, and it modified the pension formula for current and future LEF 2 members. Retired members receive a lump sum of $100 per service credit month worked, whereas current members have the option to either get that lump sum or an extra 0.5% multiplier for service years 16 through 25. That goes into effect on Thursday. And the purpose of that law was because many members would retire before they're eligible for federal benefits like Medicare, and so that provided a kind of a bridge for those members. The only other thing that I noticed was there's an interesting case that came out of Richland, public records case, where a firefighter made a claim of harassment, 2 claims actually, and the city engaged outside investigators to investigate those claims. A lot of times when there was no thought that there would be litigation arising out of a complaint, the city internally would conduct it, either the HR department or maybe the city attorney. But here, there was a real concern that there would ultimately be litigation, and so they engaged outside investigators. At the end of the investigation, the individual who had filed the complaint made a public records request for both of those reports, and the city said, no, they're covered by the attorney work product doctrine. And the attorney work product doctrine is basically the thoughts and impressions of attorneys or those people that are kind of working on behalf of the attorney in anticipation of litigation. The court established a 2-part process for determining whether something is covered by that attorney work product doctrine. And it's interesting to me because I'm engaged in a lot of investigations, and we hire the investigators ordinarily on behalf of the departments, and we always claim attorney-client privilege and work product, which can always be waived, but we always claim that. The court in this case said, first step is we have to determine if the document was truly prepared in anticipation of litigation. So we look at the subjective views of those who made the decision, as well as kind of look at it from an objective standpoint. If the answer to both of those questions is yes, then we decide whether the document would have looked differently if it hadn't been prepared in the same, whether it would have a different form if it was not prepared in anticipation of litigation. Here, the court said, they hired outside investigators. The report was limited just to determining whether there was a violation of law, whether there was any kind of illegal harassment. The investigator didn't make any kind of management recommendations or anything like that. So it was clearly work product. But you could see, but the court did make a statement in dicta, which is not a holding, but said, if this had been done internally by the city, it probably would not be covered by the attorney work product doctrine. And And the thought is that these reports are to inform the department. They're not really for the benefit of the individual that made the complaint initially. It's for the department to find out if there was anything that was done wrong, they need to take action on. So in most cases, these reports are going to receive the protection of the Attorney Work Product Doctrine. But anyhow, I found that to be an interesting case, and that is all that I have for this month, and I'll be happy to answer any questions.
Thank you. Any questions, comments? Commissioner Chan?
Yeah, actually, that has come out from the seminar on lecture. And have you ever deal with about policy do not allow fertilization or romance, whatever, in the workplace? I think that's a really touchy subject because you get into the situations of individual, off duties stuff. What is your point on that?
Well, a lot of departments have policies like that in place. And the concern is always when there is a supervisor relationship with the other individual, because you're concerned about potential harassment in that case. And so I don't know offhand if South County Fire has such a policy. Sandra might know off the top of her head, but it is, some kind of policy to deal with those situations that compels the employees to at least let the department know that that kind of relationship exists, so that it can be monitored and ensure that that there's no unlawful harassment or anything else that would be inappropriate. That's common for departments to have a policy like that.
In my prior business, in a cruise line, we do have basically no fertilization, no that, but also the attorney bringing saying that, yeah, those are private things, but that bring the risk to the organization. Therefore, we need to, because the risk has to talk to everybody. And of course, make a joke too that it always end up to either they got married or they split, which one is both are not a good ending. But to me, it is a monitoring, but that's difficult, right? How do you monitor, right? I mean,
and even if you have a policy, that the employees may not come to you and let you know that. Sometimes you find out around about somebody tips you off or something like that. So,
well, on the cruise line, that's really we know it right away, because when they split, then they spread into really not a good environment. So, okay, so yeah, maybe we should re-review. I never paid too much attention, but this seminars kind of promote me getting a lot of thought, because eventually I'll talk a bit more, but it is my concern, because in general, I mentioned that sexual harassment, nobody want to, I think, well, I have two people, Melissa and Commissioner Daniel also at the meeting. Most of the time, in the beginning, people really do not want to complain because they want to get along. And that's why that's the biggest risk that we don't know. So it usually it will become worse because the situation. We need to take a good look at that. Is your firm able to help us too, or we have to really go to a special HR? I think we do have, we still have the other HR firm that we might need to talk to them.
I'll let Sandra deal with that, but it may be Summit that would help you with that.
Yeah, yeah, that's one situation that because of union interference, they cannot remove the person. And eventually, they lost the coverage. That's my biggest concern.
Mm-hmm.
Yeah. All right.
Any additional questions for Rich? All right, thank you.
Okay, thank you.
Moving on to item 9, our union report with Zach Cash.
Good evening, all. Per President Hoover, there is no report this week. Thank you.
Any questions on that? Seeing none, thank you. Moving on to item 10, our unfinished business. Item 10A, our benefit administration company medical self-insurance update with Tim Hill. You're on mute, sir.
Yeah, and we'll turn it over to Director Hollenbeck here to get introduction started for Tim, and then we'll go from there. Sorry,
Great.
Chair. Director Hollenbeck.
Sure. Thank you. Good evening, commissioners. Welcome, Tim. I'm glad to have you back this evening. Tim is back here, as you know, on requests that we keep the board updated on a regular basis on the performance of our self-insurance plan. He's got a slide deck that he's going to run through. I know that there were there was a handout in your packet that has a little bit more detail than is easy to display on a PowerPoint slide. So the PowerPoint deck that he'll be going through will kind of hit the highlights, but there's the detail in case you want to dig into it a little bit deeper there in your packet. Sorry, I didn't know the page number, but I know it's in there. So with that, I'm not certain that we had all the commissioners here last time Tim was here. So it might be helpful, Tim, for you to just give a quick overview of yourself and what you do for us, and how we partner with you. So thank you.
Thanks, Sandra. Yes, my name is Tim Hill, and I'm the principal manager of Benefit Administration Company. We deal exclusively in employee benefits. We also are a trust company, so we have a fiduciary responsibility to our clients. But essentially, we do all the negotiations for the stop loss insurance for the self-insured plan. We also get involved in design issues and data accumulation to make decisions on, which is what we're going through tonight. But I've been with the company now. I own the company, so I've been here for 30 years, 35 years doing the same thing. What I wanted to mention early on is that the packet that you got, that you have the report in, is available on a quarterly basis. And Sandra, I think we talked about this a little bit and really asked the question, the report that we're giving you tonight can be made available on a quarterly basis, not so much in terms of having a presentation at your meetings, but we can make this report available to you on a rotating or a rolling 12-month period. And I think provide some really good information for you. So if you want to do that, we're certainly happy to create this report and deliver it to you periodically. So can we get the first slide up, Sandra? Can we get to the overview?
Okay. And for
So Lori Robertson is navigating, so just let her know when you want to move to the next slide. That's great.
Okay.
there we go.
The agenda for this presentation, and again, I'll be going very briefly over each slide because you already have the slides, and we talked a lot about this last time. But again, the information is a 12-month period, and we're doing a 12-month rolling period for this data. In item 2, we'll talk about costs for the plan by age, costs by range summary, prescription summary, what kinds of costs are being incurred for prescriptions, preventive screening summary. That's an important summary because we noted last time that the percentage of the population using preventive screenings is very, very low compared to national benchmarks. So we'll talk a little bit more about that, utilization benchmark summary, and then we'll finally summarize. So we can go to the next slide, please. This slide, really, most of the data is down on the claims analysis overview on the right-hand side. And it's kind of interesting. If you take a look at the total plan payments, it does provide a good breakdown of where those payments came from. You'll see that in that chart, there were total charges or total claims of 13.5 million. And then provider reductions, which are essentially reductions or discounts that we receive from the network that we're involved in, of about 5 million. So there's a significant reduction in total charges just because of the network that we're using. But the interesting part of this slide is that the projected claim liability costs for the 12-month period ending 4/30/22 was 6.582 million. Now, that number is given to us by the insurance company. So the actuaries and the underwriters get together and, based upon your prior claims history and the demographics of your group, come up with a 12-month projection of what claims should be. And that's the basis on which they charge stop loss premium or insurance premium to cover stop loss. The good news is that the plan payment was only $5.4 million during that same period, which is really a barometer of the health of the plan. The insurance company thinks you're going to spend 6.5 million. We only spent 5.4 million, and it's probably the healthiest plan that we work with in our company. And so that's a great trend. It's occurred ever since we started the self-insurance program here. And there's no reason why it can't continue to happen. One of the more interesting things is that if you want to compare the self-insured cost of your plan with what you probably would end up paying an insurance company for a fully insured plan, that $6.5 million plus costs would be the premium that you would be charged for a fully insured plan. So that's a significant savings. It's a savings of well over $1 million, including additional amounts that we save because of administrative fees and other fees that are normally charged by the insurance company. So that's a significant barometer. I think it's very important. Does anybody have any questions on that one? No. Okay, next slide, please. This is simply a breakdown of the cost by age groups. And 65 and over obviously are a very small percentage of the both the charges and the population. There's a slight percentage reduction of down to 3.1% because of Medicare coordination. But this is just kind of an interesting little slide that we thought you might be interested in, and it gives good information. Nothing necessarily indicative of any changes that need to be made, but it is good information. And we go to the next slide. This slide gives a breakdown of claims by the number of members, the percentage of the number of members, and the plan payments and out-of-pocket costs for employees. And what's interesting to note is that if you go down to the 100,000 and over claims, there were actually 4 of those. 4 members had over $100,000 in claims each. 100% of those 4 claims is pharmacy. So there were some significant conditions that required the use of probably more specialty drugs than would be normal. But we do have 4 large claims this period. Pretty unusual. I don't think we've seen, Sandra, you can back me up on this, but I don't think we've seen those kinds of claims, especially on the pharmacy side, in a long time.
No, that's unusual for sure.
Yeah. Any questions on this? Yes.
Yeah, I noticed a lot of specialty drugs and stuff like that. And then there's also, now I know that if you are Medicare, there's also too about layer of the thing. Is there any way we can request them trying to get the doctor to write a generic or some equivalent type of thing? Or is that really not, you cannot do that? It have to be based on whatever the patient likes to do.
Well, we have a breakdown of that in another slide, and I think the fact of the matter is that if the physician requires a specialty drug that's not available generically, then there's nothing really much we can do about managing that. But I will say though, and it is important to realize that all the large claims that come in are subject to case management. And so when a large pharmacy claim comes in, there's a special task force, if you will, at the administrative office that does an audit and does research and consultation with the providers, both pharmacy and the physician. So they try to manage this and try to work out a situation where they're not, where it's possible not to use specialty drugs, they'll do that. So there is a process in place.
I think there's also change too, because that's why pharmacy or the drug company really advertising a lot on the television. And I know those are drugs are expensive otherwise. And then patients just saw that and then trying to go to the patient physician to subscribe them. And a lot of time physicians as well, that's what we want, especially there's no, in our situations, there's no deduction, there's no copay and all of that. That's kind of my biggest concern. And it is, there's no other That's the case. I mean, can the case manager really say, hey, there's another drug very similar, we should try to do that? Or
Well,
not
there's
really?
certainly, there's a fair amount of negotiation that goes on, and it's a constant, especially with large claims and significant major conditions. The case managers are talking to the physicians, they're talking to the pharmacy. They're really trying to do and they do a great job of managing these cases. But where the physician is required a particular brand name, even though there is a generic equivalent, there's really not much we can do to override the physician.
Yeah, I think, well, because in general policy, they have co-pays, so the patient will even trying to be kind of margin, but with being no pay, that incentive is kind of taken out already. That is my major concern, especially you express there's the 4 major expenses there.
Yeah, and those 4 pharmacy claims represented 41% of the employee costs. That's
Yeah.
significant.
It is very
And so,
significant.
yeah, but so the best we can do for that is to manage the managers, if you will, to make sure that the case management folks are on top of this, and we do. We speak to the administrative office 2 or 3 times a week, but they do a good job. They have a good process in place for managing those claims and keeping those costs down. But unfortunately, for significant conditions, specialty drugs are pretty much the only answer in some cases. So.
No, I was surprised. A lot of drugs is so expensive. But also too, now the stop loss is aggregate, right? You just cannot go into individual policy and say, if this person go over that stop loss, doesn't work that way, right?
Well, it does on an individual basis. So we have, if we do have very specific stop loss for individuals, and that's set at 350,000 or 325,000, I think. I don't have the renewal. I think it's 350,000. And claims for an individual that go above that are paid by the insurance company.
Okay.
So we do have stop loss at the individual level, and then on the aggregate or total level.
Okay.
That's at $2 million. And so that's where the insurance company stops paying claims above 2 million, but it would be impossible for this plan to go over that level. So the stop loss at 325, actually, the stop loss is a very, very legitimate level at which you should be concerned about creating some protection in stop loss. And it's working out very well. We just have not had anybody hit that 325 stop loss level.
Okay.
So it is set at the right level.
No, but that can be also adjusted in the future if we send it getting more and more and get the stop loss level lower down or pay more premium.
Stop loss level can be lowered down. It can also be raised. And that's when we went through the renewal this year, we did provide various options at various levels of stop loss, especially the individual stop loss. And rates go down. The premium for stop loss insurance goes down as you increase that stop loss level. But our recommendation in working with Sandra, we really feel that you're right at an optimum level at that 325.
Okay.
So based on experience, based on the claims that are coming in, it's a good level to be at.
Oh, I appreciate it. Thank you. Thank you.
Mm-hmm.
Tim,
Okay,
Jim
next
Kenny
slide.
here. I've got a question for you on this slide.
Sure.
I was curious about that no claims at the top, the no claims, 34 members, no claims, the percentage of that, 6.8%. Is that high, low compared to other plans that you see?
Well, I think that's kind of, we generally see about 15 to 20% in a population your size of people that never go to the doctor or never need a prescription. So that number, your number actually is very low compared to the rest of our clients and the rest of the TPA's clients.
Okay, thank you.
Good. Any other questions on this? This is probably the most important slide that we'll look at. So it really gives you a great barometer of the health of the plan.
Commissioner Rowland?
Yeah, so just so I kind of understand all these terms, some of this is new to me. With the stop loss, just doing a simple calculator type thing. Those 4 members, that 41%, that 1.184 million, it ends up working out to be about just around 300,000. So just hypothetically, if our stop loss was down, instead of 325, it was at 250, what would happen with those claims? And what would that do to kind of the whole plan and how we do this?
Well, the stop loss level at the individual level, so the 325 that we currently have, means that for that individual, the plan is responsible for making payments up to 325,000. And then the insurance kicks in and pays claims over 325,000. Okay, so if you lowered the number, if you lowered down to 250, the plan would be responsible for claims up to 250 and the insurance company the excess. Now, the cost of doing that, you have to realize that the cost of doing that, the insurance premium for those kinds of low levels of stop loss are very expensive. And if you match that up, which we do, we match that up with the claims that have been coming in, that 325 magically is just an optimum number.
Gotcha. So if we were to lower it, we'd be ending up paying more to the insurance companies than what we're paying right now to actually cover these claims.
That's right. That's right.
Gotcha. Thank you.
And in many cases at 220 or 250, let's say we lowered it to 75,000, there wouldn't be a corresponding reduction in premium sufficient enough to expose you to that additional liability. If that makes sense?
Yes, it does. Thank you.
Okay. Good. Next slide, please. Okay, this is from a different time frame, but this gives you a breakdown again of members and the large claims. There was an additional 2 large claims over 100,000 in this time period. But this gives you a little bit more detail. I think I won't go into this in detail. If you have questions, I'm more than happy to discuss it. But let's go on to the next slide. And this is the prescription summary. What's interesting about this is the earlier question, I think, Commissioner Chan, you had is what's the mix of generic versus brand and patient requested versus doctor requested? So this gives us a good breakdown of what that is. Specialty drug obviously has a very small percentage of total claims, but a very high percentage of actual dollars. I will say that the generic prescription utilization is the highest of any of our clients. It's at 86%. So if you take all the prescriptions that were utilized, 11,000 of them in the generic, that represented 86% of the total utilization, but only 18% of the charges. So you can see there's a disproportionate cost associated with going brand and then specialty drug. Questions on this?
Yeah, actually, you said you compare your clients. Are you most of your clients a fire department or completely different?
No, they're not. And when we look at our client base, we also look at HMA's, the TPA's client base.
Right.
It's really the entire client base. We don't have the data to break it down by fire districts versus other industries. So it basically is an entire population that we're looking at.
Because in the sense that I know that a lot of companies now promoted healthy lifestyle and all this stuff, but in general, I have to say that actually Chief Withers can, not Chief Withers, Chief Horace can answer that question. Before we have the kind of mandatory 2 hours of exercise for firefighter to do that, we still have that, Chief Horace?
Yeah,
because I remember I met you when you're riding on the exercise bike. That's my first impression.
You wouldn't believe it. My feet are moving underneath the table right now. I've got a little mini bike, but yeah,
Okay.
that's the wellness fitness initiative for our uniformed employees, and that goes back to the late 90s
Right.
for those workouts, and so that's the answer to that, Commissioner Chan.
So still going, because I remember we spent a lot of money when I first got on with all the exercise equipments and everything else, and we're still we still maintain that very good?
We're,
Okay.
we're still at that, we're busier. It's harder to get those workout times in. I think when you visited, that was early evening time, just so I could get that one in. But no, we're still doing that. And Tim will continue to this presentation. One of the things we talked about, Tim, Sandra, and I, is we've gotten to be younger as a fire
Right.
agency, although we have grown. There's more members in our plan originally, but our demographic, we had about 20 years of average service in the uniformed ranks. When you and I had that conversation, we're down to about 11 years of service. So, and the population is growing, but they were getting younger. So we are healthier than some of the other data, but we don't have comparators of other fire districts, RFAs, or city employees. So it's very interesting. So
How about the family wise? Do we have any kind of program to encouraging the family have a healthy life too, or they can do it themselves?
well, they're all covered under the medical insurance plan, and they're getting younger too. Tim will get to that. I think we added 41
Right.
members, and some of those were happy birthdays for the first year. So they are encouraged to do that through the plan themselves. But we can't make them work out 2 hours a day at home as significant others or children. But I know we do have a younger workforce and younger families. Yeah.
All right. Good. Thank you.
Thank you.
Good. Just one other comment on this slide, and that is take a look at the percentage of specialty drug utilization, which means the number of prescriptions written is less than 1%, but it covers 42% of the charges. So you can see how that really is disproportionate and how very expensive these specialty drugs are. I had one just the other day from another client because I get notified for large claims. I had one person who has a condition that's requiring a specialty drug at $35,000 a month.
Ooh.
And so it can be really devastating. And so we really, the best we can do, and we are doing it, and that is to make sure that there's a heavy amount of case management on these things so that we know exactly what's going on all the time, and that the case managers are doing the best job they can to negotiate these costs. So anyway, next slide, please. We put this up here. This is kind of an ongoing measurement of how many folks are actually doing preventive screening. And when we look at the percentages of different conditions, and especially cancers, there's just not a lot of preventive screenings going on. You take a look at even the bottom line preventive care visit, that's basically physicals. 38% of your folks are getting physicals. There's also a very small percentage breast cancer screenings, cervical cancer screenings, all sorts of screenings that are available under the plan, but the percentages, as you can see, are very low. And so what we did was at the commissioner's request last time, Sandra and I got together and we looked at some materials that can be distributed to members regarding screenings and the availability of screenings. And Sandra, did you want to comment on that as to where we are? I know that those are currently being reviewed.
Sure. Thanks, Tim. I mean, a few things. Going through that, we have an internal wellness fitness tag group, a group that was working on things that help our employees to be as healthy as they can be. So we're coordinating with them, taking some of those materials and figuring out how we can make it a little bit more personalized for our staff. And just remind folks that while they take generally good care of themselves as firefighters, that it certainly is important for them to be investing in that same level of care for their families and for their dependents. We just, as a matter of fact, talked with Tim Hoover today, hoping to get some help from the union to do some messaging. So yeah, we have a number of things that are kind of brewing to see what we can do, what's going to resonate with folks to get them really thinking about that preventative care. And then internally, I don't know, Chief Hovis, you want to talk a little bit about the meeting we had today, but there's some things going on internally with the care of our firefighters as well.
Yeah, thank you, Sandra. And commissioners, I haven't talked about this yet, but many of you have met or heard of Greg Lind, who's been a provider for many of our employees for many years. He used to own the Lake Serene Clinic. And when he sold that, he came here and really helped us work through some of the wellness fitness initiative we talked through previously. He's been here for a lot of growth, but he is going to hang it up and retire. So we have had a few meetings with another person, and that person used to be a nurse. They have their own practice. They actually went back to school and are a doctor, and can offer some other additional services and screenings that weren't maybe as encouraged or offered or available with Greg Lynn. So we're going to turn the corner, and I think hopefully have a good arrangements where employees can see them. And so we'll be talking more about that here in the near future. We're just not quite there yet, and I don't want to mention their name, but we're getting a little bit closer. But that will help. And one of the things that in our conversation with Chief Isotale and I talking with Greg Lynn, some of this preventive has been difficult through COVID and some of these visits, but we really do need to not just capture the uniformed employees. This is about our South County Fire family, which includes all of the members, eligible members. So I think that covers everything, Sandra.
I believe it does. I think that was a good point about COVID. I think we saw the numbers drop off in preventative care, everywhere in probably the world. And so it'll be interesting to see as people get back into the swing of things, how that pops back up as well, just naturally.
Yep. Okay. Any other questions on this slide? Preventive screening. Okay, next slide, please.
Tim, I believe there's a question from Commissioner Chan.
Oh, sorry.
Yeah, so Mr. Well, I always enjoy you coming here because from my prior experience, this is another biggest, expenses for the company. Do you know, do we have a data, who are most of the providers? I know that, example, the network of UDAP or other clinic have more focus on preventive, that type of thing. Have you any study on that? Like, then we can encouraging some of our, well, first of all, who are the major provider for our group, and then any way you can encouraging them to go to another providers.
Yeah, well, we don't necessarily, we do get the claims, so we do know who the providers are, but generally all of the providers fall within the Regents network.
Okay.
And the Regents network is one of the best networks in the state. It just is that most providers are members of the Regents network. I believe I read that the Everett Clinic was the largest provider in your plan in terms of numbers of visits, which makes sense. But I don't have that breakdown right now. I can ask and see if we can get that, but the advantage, as you saw in earlier numbers, of having a large network like Regents is that we're able to negotiate discounts, significant discounts from the gross billing of a physician. We're able to negotiate those costs down. Same way with pharmacy. And so being part of the Regents network, I think, is really working in the best interest of the plan.
Everett was a paid, they do promote screening, so that's good. Yeah.
Yeah. Well, I'm a big fan of Everett Clinic. My daughter's a nurse there. So okay, next slide, please. This is the utilization benchmark summary, and I don't know if we're able to see this with our faces here. There's another column there that I think is important. Can you guys see that? Well, this is I'll just talk through it. Most categories of service are lower than the national averages. If you take a look at the full screen, you'll be able to see that in essentially every area of emergency room visits, mammogram services, mammographies. You're doing very well in those areas, and you're actually beating the benchmark, which is a national benchmark. And so I'd encourage you to take a look at this. It's good information. I think it shows that the utilization in your plan is very good in terms of not utilizing these kinds of services when it's not necessary. So that's an encouraging sign. And we look at the health of the plan in terms of two things, really, claims and costs. And so far, your claims, as we saw on the first slide, are over $1 million lower than what would be expected. And this data is good information terms as well in terms of utilization benchmarks against a national average. So that kind of answers half of your question, Commissioner Chan. Any other questions on this? By the way, the dental is covered under Delta Dental and is not part of this plan. Okay, next slide, please. This is simply a benchmark. Again, it's hard to see. We give you national benchmark data, but there's a higher than national average for cancer cases of all types, which is noted in the middle section of this slide. I'm not sure if that's indicative of the industry, but certainly the national averages are much lower than your averages in terms of cancers at least. So why don't we go on to the next slide from there. Okay, in summary, there was a population increase of 41 total members, but interestingly enough, costs went down a fraction. So that's good. The new members are probably young people who don't use medical facilities that often. Overall costs were down. Employees and retirees make up 53% of total charges. Dependents make up 47%. The reason that's important is you don't want a major disproportionate utilization among any particular area of the population. So the fact that dependents make up 47% and 53% for employees and retirees, I think is great, is a good mix. And it doesn't indicate that we should adjust premiums or anything else as a result of that mix. Majority of the costs, of course, are all people under 65. Those over 65 represent 4.3% of the population, but because of Medicare offsets, the cost is really 3.1%. We talked about the higher than national average for cancer cases, and again, beating the drum for screenings. That's the key. That if you read the literature, that is absolutely the key to keeping costs down, and especially in terms of cancers. And so if we can encourage that, that would be great. Low percentage of preventive services compared to the national average. We saw that in terms of just physicals, that it was down 38%. And so that's a concern. But again, we can utilize information and utilize education to try and encourage preventive services. So that concludes the report. Any questions?
Thank you. Commissioner Chan?
Did I exceed my quota for questions? Well, actually,
Not as far as I'm concerned.
I'm sorry, this is my major concern about, maybe that's a question for Chief Ovis too. On the retiree, do we separate from that one versus left two people? And how do we handle that?
That's probably a great
Agreed.
question. Or was that for me, Commissioner Chan,
well,
or
either one.
Tim?
Yeah.
Well, we can let Tim. You were going somewhere. Do you want to answer that?
Could I get the question again? I didn't quite.
Yeah, we have two separate retirement program. One's left one and left two. Do we
Right.
separate them, and how's that affecting our claims and everything else?
Well, we do separate them. We know who they are.
Right.
It is for retirees is a very small proportion of utilization. And so we haven't had a concern about retirees or the cost of retirees because their utilization is such a small percentage of the total that we just haven't really had to do anything for that.
Okay, so right now you do separate them, but you don't really, the claim wise, left one or left two is not that significant difference, or?
No, there really isn't a significant difference.
Okay, all right.
Sandra, do you want to build any more on that answer? Because I know we talked about that briefly, the difference between left one boards, the obligation of the employer for those versus left two on the plan that don't have that extra pay obligation like a left one employee.
Yeah, I don't think I have a lot more to add, Chief. I
Okay.
mean, I think that it is a small number, frankly, and not sure that it merits a whole lot of additional discussion unless Tim does.
Okay, thank you.
All right.
We can slice and dice the data any way you'd like. So if there are questions like this, we can go into the data and actually get some hard numbers for you. So feel free to ask, request any reports that you might like, and we can get the data.
Okay.
Commissioner Kenny, then Commissioner Rowland.
Tim, I wanted to go back to the the cancer. You don't have to put it up. I'm just scrolling back to it. The cancer screen and the texts on the left-hand side indicates that we have 40 members out of our almost 1,000 members that are currently receiving cancer treatment. Do you have that broken out by dependents versus employees, retirees, or no?
We don't have the cancer treatment broken out that way. We do have information on dependents' total costs versus members or versus employees. I could check on that, Commissioner Kenny. I don't know.
I guess it's not essential for my thought, but I do want to. It leads to my next question, which is because some of those dependent, 40 people may be dependents, and it just may be unrelated to the fire service, but the fire service has exposure to carcinogens in the nature of the work, and cancers in firefighters and retired firefighters is a concern. And I was curious when you mentioned, I actually did be in the screen before that the 3 point, maybe I'm missing it. I wanted to say it says 3%. 3% of our members that was a high number receiving a cancer treatment. If you had other thoughts about how to get more screenings related to that, get more early detection, because that's, I think, it's an industry concern, and I kind of want to relate it to our actual employees and how to do something about it.
Yeah. And we talked about a little bit about this last time, and what we were going to do to try and encourage screenings, which is the major way you prevent these kinds of diseases, or at least recognize them. And I think some of the material that we're working on with Sandra is going to do a good job of raising the level of awareness of screenings, or the necessity of having screenings. I can tell you this, that of the 4 large claims that were all pharmacy, 3 of them, I believe, were dependents. Okay, so that kind of, and I'm guessing that cancer had to be in there somewhere for those large claims like that on pharmacy. So I don't know directly, but I can say that of the 4 large claims we had, 3 were dependents, and they were large pharmacy claims.
Okay, thank you.
Mm-hmm.
Commissioner Rowland.
So real quick here, a lot of data here, a lot of good numbers. Are there any recommendations, associated with this? Any changes that we should be looking at?
Quite frankly, I'm a little afraid to change anything. That the plan is in good health, and what's not broke, don't fix it, kind of thing. I think that one of the things that we need to work on is more education in terms of screenings and health, taking responsibility for your health. There's a lot of information on the internet. There's good information, handouts that we've constructed or prepared. So I think we're going to embark on that kind of education. But I don't think anything structurally or from a design standpoint really would benefit the plan more than it's already being benefited. So I think the right structure is in place. I think the right stop loss levels are in place for your plan. The plan is extremely healthy in terms of, by the way, in terms of healthy, when we first did this work, started the stop loss plan or the self-insured plan, we weren't able to find an insurance carrier for the plan. And the reason for that was that there were no claims history. No claims history was available to us because you were part of a trust at that time. Now, because you have your claims information, we're in a much better position to negotiate rates and negotiate costs associated with the plan. So getting back to your original question, I wouldn't think we need to do much right now. If something comes up that we need to make a change, we'll be on top of it. But for now, I think the plan is healthy. I think the plan is doing what it's supposed to be doing in providing care for your employees and your members. And I think things are just, compared to what I see out there in the marketplace and with our clientele, this plan is doing very well. And by the way, the insurance company loves you.
I don't know if
Mr. Chair?
I don't know if that's a good thing or a bad thing.
I promise this is my last questions and comments. I know probably addressed to Hovers and I think Commissioner Kennedy bring out a good point about it. This is nothing about money, it's about the cancer and all that stuff. I know that in the beginning, many of the majority of retiree, when they were not so serious about the helmets and this breathing apparatus and all that stuff. So my question, are we restrict on that now, that when they put on the gear and all of that stuff to protect themselves?
Absolutely.
The reason I asked, I just saw the movie Top Gun, right? That, I mean, it's great for Hollywood. Tom Cruise riding the bike with the pod and back, no helmet, nothing. To me, that is not a good message to send to the public, especially younger people.
I bet if Tom Cruise could have taken that back on that Ninja 600, he'd do it right now with all the kids he has. But yeah, I'd agree with you, Commissioner Chan. We got to have all of our gear in place. Just for the commissioners, some probably already know this, but presumptive illness for firefighters or occupational disease was first passed into law in Washington State Legislature in 1987. It's been updated 4 times, most recently in 2019. But we need to protect our people, whether they're firefighters or not in our organization, for those types of cancers, heart and respiratory diseases, infectious diseases, and most recently, which we didn't talk about today, post-traumatic stress disorder.
Right.
For our career firefighters, as well as all of the members of our organization that have been really working through this pandemic. So if we can focus on those things that we know the state has identified as risk for firefighters, and even those that haven't, for the last firefighter we lost in this organization, which is just outside of this window, and probably some of his medications were on the time period of this time, Les Fredrickson, right? Or Duffy Burns before him, or Conrad Clemenson before him, or Bob Morehouse before him, or Bill Angel before him. And I could keep going on. That is what's taken the lives of our firefighters generally, because you can't see it, can't smell it, and you don't know it's there. There's better tests now, and you can figure out when your heart disease might be getting at you, but those are the things we need to focus on. So we're healthy in, healthy out is the message. Wear your gear. And even with everything we do, we're going to have members of our organization, whether they started 42 years ago, like firefighter Steve Francis that's with us, or if they started on Monday. That's the goal. And,
no, I think, yeah, emphasize the mentor. I said many times, I cannot do their job. Car accident, I don't like blood. All that, especially I know that when they have dealing with children, I mean, that is hit hard. So I just.
Yeah, everybody, I appreciate it. And everybody knows that. And I told these recruits about it. You know, even my aunt fell victim to cancer as a Seattle firefighter's first Class A uniform time I wore at her service. And I was a pallbearer with the rest of her Seattle Fire teammates at the time. So if we're not, everyone takes this very seriously, and we appreciate, what Tim does for us now and what Sandra's doing for the plan, and your support as commissioners to do what we've talked about for a long time, get a good self-insured plan so we can be in charge of it. We can control costs, and when we need to do things that can help all of the members of the plan, we're going to do so. But yeah, to answer your question, Commissioner Chan, they've got the helmets on, and Tom Cruise is no example, but I'm going to go to that movie on Friday, I think.
Okay.
So the new
All
one.
right.
Commissioner Kenny?
Tim, I always like to ask you, and maybe in part you've answered it, but I always like to ask you every time you're here, because I remember when we were with third-party providers and how we jumped providers looking for
Right.
a cheaper day with better quality. And since we've gone self-insured, which it's been quite a few years, occasionally third party, somebody who represents a third party provider will come sniffing around. So my question to you is, are we better off financially saving more versus a third party provider? And are we better off quality wise for the actual quality of service that we're giving to our employees?
Well, certainly in the cost side of the equation, you're much better off by about $1.1 million versus being fully insured, if that's what you're talking about. So the difference between being fully insured and self-insured is about $1.5 million when you include costs. So the insurance company, again, on that first slide, is going to take your projected claims and add their administrative costs and profit, which is about 20 to 25% in this size plan. And that would be the total cost of the plan. You're converting variable costs in terms of claims to fixed costs. And that makes no sense to me at all, especially with the good performance that you guys have had ever since you became self-insured. You are totally in charge of the quality of your plan, and you're not part of an insurance company who's part of a network and controlling, decisions on healthcare. When a self-insured plan has much more flexibility in terms of services provided and the quality of the care and adjusting the quality of the care when you want to. So I don't know if that answered your question. I hope it did.
It does.
But,
it does.
Yeah.
And then I just wanted to make a comment about in the past, the board's philosophy about providing good health insurance, whether it's through a third-party provider or more recent years, a self-insured, is to keep our employees healthy, but also keep their dependents healthy. Because if the dependents are healthy, then first if our employees are healthy, then they come to work and they work better if they're healthy. But also if their dependents are healthy, they are taking less time as sick time trying to assist their dependents. They are more mentally capable to do good work in the sense that they're not worried about their dependents. And so having good insurance that benefits us as the employer, both for the dependent coming to work and also, for the employee coming to work, but also for their dependents. Because at the end of the day, we need healthy employees to keep providing service in an environment where they're exposed to disease and other unhealthy environments. It's a job risk. And so providing that, even though it's expensive, and you can see the millions of dollars we're putting into it, is a benefit to continue to provide a good service to our taxpayers. So I do hope that commitment to doing this and providing not only quality service care to our employees, health insurance, but that continues into the future. I think it's really important for our ability to provide service to the community. So I appreciate, Tim, you coming tonight and the opportunity to talk about this and just touch base on it once a year, because we don't talk about it a lot, but it's really important for all the people that are doing work. I know, the healthcare that my family gets through, my work in a different environment, super important. Everybody thinks about it all the time. We just don't talk about it here much. So it's good to talk about it once a year and just see some of the trends and think about, how can we push some of these things in a better direction, the cancer, the screenings, those type of things. So great information. Thank you very much.
Good. You're welcome. Thank you.
I just want to echo Commissioner Kenny's, when we make the decision, switching from the provider versus self, it was very difficult. I mean, we did a lot of study. So I think we negotiated with the union, one of the things that I wanted personally to see, we are the best, provide the best health care for all the fire department in the state of Washington. And that's, I want to achieve that. So thank you for helping us to do that.
Oh, you're welcome. Very good. Well, I appreciate the opportunity to visit with you tonight. As I mentioned in the beginning, if you'd like to have this kind of report, we created this template that we can put together pretty easily and get it out to you if you'd like to do it more frequently or you'd like to see it more frequently. I'm always available if you have questions and it's appropriate. Feel free to give me a call directly. And so we're available at all times to help not only you guys understand the plan, but understand any conditions that come along. So keep that in mind.
Chief Hovis.
So I want to thank the commissioners for the support they've given tonight and the presentation by Tim. But as one of those employees that we jumped around 3 medical plans over 4 years, it's great to have the stability. And part of the thing we didn't talk about is this data was not available previously because you needed 3 years of aggregate data to even get a quote from anybody. So having the stability, being able to look at the data and be in this place is a credit to where we were before this RFA was formed. So I want to thank all of the commissioners that have made that happen, and staff, and also the commissioners and staff that continue to make that happen, because we're in a better place now than we were during that difficult period, jumping from the Aetna Snoopy plan to the commissioner's plan. And I could go on, but it's really nice to be able to carry a card in your pocket when you do have those pharmaceutical copays or whatever it is, with one card that says South County Fire on it, with one company and one Regents network. So thank you again, Tim, for presentation. Thank you, Commissioner, for your comments.
Great. Thank you.
All right, it's 8:25. We're going to go ahead and take our 10-minute break. We'll return back with item 10B, our 2023 budget calendar. So it is 8:25, 8:26. Let's join back at 8:35 and continue with our agenda. It's 8:35, returning back from our break. And we're starting back with item 10B, our 2023 budget calendar development. Follow up with CFO Bothwell and Chief Hovis.
Good evening, commissioners. There is an updated budget calendar in your packet. The updates that we made were responsive to the feedback we received at the last meeting. And those updates are, we moved the presentation of the chief's preliminary budget from October 18th to October 4th. And that let us schedule 2 additional touches for the Board of Commissioners with the budget, with the preliminary budget. And those are scheduled now on October 11th and October 18th. And those were that's all of the last update. If there's any questions, I'm happy to take those. Otherwise, if the calendar looks good as it is, we'd like for you to approve it tonight.
Great. Any questions, comments on the budget calendar? Commissioner Chan?
Yeah, well, first of all, CFO Boswell, I thought I wanted you to tell me that you joined us because you love our health plans. Is that one of the reasons?
Sure, that's fair.
Okay. No, actually, it's a very good schedule in there. But when you say about preliminary budget, so if we have something that we say, yeah, we want to add something. Well, first of all, my philosophy always been give you a perimeter and you got to come up with the situation. Now, do you continue adjusting if all is here to head knocks and say, yeah, would you adjust those budget along the way, or you just wait until all the way to the end?
We can make incremental updates if that's what the board prefers. In fact, that's, if the board wants us to bring back analysis based on certain proposals or things that are coming, things that they're deliberating on, we can totally do that. That's completely up to the board. Once the fire chief's budget, the preliminary budget, is given over to the board, it really becomes yours. And so you're in the driver's seat. You can tell us what you want to see, and then we make adjustments based on what you want to see at that point. So up until then, we're going to have a lot of information and a lot of data and a lot of kind of analysis that we're going to share with you. So we kind of bring you along so you see how the chief's budget came together, and we're going to be looking for feedback. But once he hands that over, it really is yours, and you can it's sort of your process at that point.
Okay, great. That's why I like the dialogue, go on and do interaction and all this stuff. And you get a head knock, about what that is, rather than one big giant adjustment at the end. Okay, thank you.
Commissioner Daniels?
I move to approve the calendar.
Is there a second on that motion? Commissioner Teoflag? Any discussion on the motion? I had one quick question. So I see we've got the presentation of the revenue forecast and the capacity report is kind of one of the first things. At what point in the process is that the finalized number right there? Is there a point in the process where we get kind of an updated, more accurate number? Because if we're looking at a number like 80 million and we're basing our kind of status quo budget off of that, and then we've got our ads, you know, at what point in this process do we know the revenues are kind of pretty accurately set before we have to kind of make determinations on, you know, additional ads to the existing kind of budget?
Great question. So the data gets better as we go along. The data gets really good in about October. So in July, what we'll have is we'll have the countywide numbers. So we'll know what AV is doing or assessed value is doing for like countywide. Shortly thereafter, probably after this presentation, within a couple of weeks, we will have what it means for the RFA, what our actual AV change is. And then we'll have our new construction numbers, preliminary new construction numbers will be coming in then too. Those will continue to be adjusted though through October, the new construction numbers. And then there's some small stuff that comes in after October, like, you know, state assessed utilities and some kind of weird stuff that isn't really too significant, but there will be some kind of smaller changes that come along the way as well. So we don't have a really good number until really, really late in the process, like a perfect number. But the data gets really good around October, and we'll continue to bring updates as we get significant updates. The assessor issues frequent updates as they get significant, you know, important data. So we'll continue to bring those to all the meetings whenever we have an update.
Okay. Is there a sense of, you know, from that preliminary to kind of what it's going to be more finalized? Is there kind of a sense of a plus or minus 5%? I mean, or is this a number that is probably going to be sticking in a couple percentage points, you know, give or take?
Yeah, I think the latter is probably more accurate. It's going to be within a couple percentage points. The new construction numbers, unless there's something really big that was added really late to the tax rolls, you know, a massive multifamily development or just something really big, a business park, or those things will move the needle late in the process. But we have pretty good data up front. It really does get better. So we'll have some really early numbers in July. By August, they'll get a little bit better. September, they'll be pretty good. And then October, we'll be really close.
Okay. Commissioner Chan?
Yeah, actually, two questions in here. Captain Eastman, Chief Eastman is here. I think at one time we talked about impact fees, and we talk about that the dollar's not that big amount. Is that do we still have impact fees? That type of.
We don't have impact fees. We talked about impact fees,
Right.
specifics to the capital facilities plan. And we discussed it. And I think one of the benefits that our new CFO brings to the table is he's very familiar with impact fees. But remember that when we got to phase 2 of the facilities plan, our facilities plan is not a GMA compliant plan. And in order for us to consider impact fees, you have to have a GMA compliant facilities plan to be able to do that. So currently, you know, we looked at it initially and for lots of reasons, the organization chose not to pursue impact fees and go down the path of the facilities plan as we did. I think there's always room to have additional dialogue with regards to that. And I think, you know, we have somebody who's dealt with that now with CFO Boswell that can actually help inform that and help guide that conversation with the RFA at some time in the future. If there's a desire to look forward to impact fees. One of the things to remember about impact fees, and I don't know where the cutoff time is, but it's about future growth and then the capital needed to address the future growth from an infrastructure perspective. And so I think I think Chris and I had the conversation, and the ideal time to have actually done this probably would have been around 2000, with in preparation for the growth of what's happening with Sound Transit. So currently, no, but I think it's always a conversation that can be had down the road. And like I said, with the addition of the new CFO, he has experience with this, and I think would be at some time in the future a conversation for that if the board so chooses.
Yeah, I just had a discussion during the conference or seminar. Another fire district have a significant impact fees. And then
that's Whatcom County, correct?
no, I'm not going to disclose which one, but
I believe Commissioner Chan, there's only one fire district or RFA in the state that's
okay,
doing impact
that's
fees,
not
and it's
even our
Whatcom
county.
County.
It's
Yeah,
a different county.
It's
Yeah.
Whatcom County that's doing it. They kind of paved the way. I mean, that agency paved the way, and we were fortunate in our discussions with impact fees. Rich's office actually helped that agency move forward and kind of pave the way for fire districts to actually do that. And to my understanding, they're the first fire district that's on it, not the first city. I mean, cities do it a lot with fire departments, but they're the first fire district that has gone down the path of imposing impact fees that I'm aware of in the state.
Yeah, oh no, it's just King County. So, and then the reason I'm looking at is that right now we have so much of a development all go vertical. Okay, that is kind of we know more station, more other, and backfill station, and those can be. And another thing is about our benefit charge. When's a deadline we want to, certain segment of the benefit charge we want to increase? Are there any deadline for that?
Say that again, Commissioner Chan. I want to make sure I understand the question.
You want to change the rate. Now we give you basically just 2% increase, that type of thing. Can we? I mean, you talk about revenue projection. If we want a benefit chart with certain commercial big box type of thing, we want changing that. When is a deadline for that for 2023?
Well, we will do that as part of the budget process, right? So the board will through the budget process decide what to set the benefit charge at.
Right.
And then staff will go and do the work that staff has done. And every year we look at, how we proportion the benefit charge amongst our properties, and that's a conversation that can happen every year. Just remember, there's things where the benefit charge and the stuff we do needs to be measurable, and a few of those things. But we have the ability to do that on an annual basis. Even though this last year we didn't change how the benefit charge was proportioned from the previous year, but the factors and stuff did get adjusted as a result of new parcels being added or new improvements being added to the overall RFA and things like that. But you as the board, we do that on an annual basis.
Right. Isn't a deadline that we need to the county to collect that amount?
We have to have the information to the county by the 30th of November. The same as your other property tax stuff.
Right.
Okay. But we'll have a public hearing on October 18th, according to the calendar, and hopefully we'll have a number by then. One other quick question on revenue side: at what point in this process, as we get the revenue projections, would we explore other notions like tapping bank capacity and things like that? When is it ideal for this process to bring those kind of conversations forward?
So the we have a revenue capacity study that we'll be sharing on the 12th of July. And so we'll talk about what those kind of levers are that you could pull if you wanted to raise additional money, and how much the bank capacity based on the change in assessed value. We'll talk about the fire benefit charge, how high that could go is 60% of our projected operating costs. We'll have a conversation about all those things. And I think one of the things that we'd like to hear from you during the budget process when we're talking about those things is what are the things you'd like to explore, and maybe share a little bit about your preferences and what you'd like to see in the chief's preliminary budget as well with respect to those things. So the conversation will start on July 13th or July 12th about those topics, but it'll be ongoing.
Okay. Any additional questions, comments before we move to a vote? All right, seeing none, all in favor, say aye.
Aye.
Commissioner Lawrence? Oh, great, motion carries. Thank you. Look forward to that process. Moving on to item 10C, our administrative salary survey with HR Director Hollenbeck and Chief Hovis.
Chair, I'll get us started. I see a couple hands up already. Okay. I'll get us started, commissioners, with page 61 of your packet is the agenda bill on this topic. On May 17th, staff was asked to bring back the McGrath salary survey that happened last year. In the agenda bill, you will notice that for commissioners that weren't here, that the commission was gracious and gave all non-represented administrative staff a 6.3% COLA increase effective January 1st, 2022. Chair Urban had further requested through that conversation, they asked on the 17th, what would an impact look like if the employees that had the salary survey recommended a market increase for certain positions, what that would look like and what those impacts to the budget would be if they came into effect at the mid-year, which is essentially July 1st, 2022. Fiscal impact, you'll notice on the agenda bill itself, when Kathleen Younglove, our former finance director, developed the budget for 2022, it had included the assumption of the acceptance of the McGrath salary survey at the time. So if there was going to be any action by the board, that has been built into the budget previously by Finance Director Younglove. So with that, I will pause, and Director Hollenbeck, do you have anything to add?
I don't think so at this time. Thanks, Chief.
Okay, thank you. And then I know we were CC'd as staff documents that had been circulated from some historical documents also to bring the commissioners maybe up to speed as well that weren't part of the commission from those previous years to include 2021. So with that, I will pause.
And just for quick clarification, so the 26,000 number would be a July 1st moving forward. The original impact of this that was put into the budget was around 40,000, I believe.
That's right, Chair Urban. It was slightly more than that. So yeah, this is roughly the halfway point, and obviously it sort of depends on when people's anniversary dates are, because we took into effect the step increases at the time that they would normally go out.
Okay, Commissioner Daniels and then Commissioner Chan.
I move to implement the 2021 McGrath classification and compensation plan effective July 1, 2022.
We have a second on the motion. Commissioner Teofloak, and discussion on the motion. Commissioner Chan?
Yeah, I was surprised that was move a discussion, the motion immediately. Actually, my question for our attorney, Rich Davis. Every year I'm really uncomfortable discussing this because individual staff and everything else. Is there any way we can have this a discussion as a executive session, that type of thing?
If your increases are based on merit, performance, then you as you know, you can review the performance of a public employee in executive session, and so an increase based on merit could certainly be discussed in executive session. But something that is cost of living increase or market adjustment, it's not tied to performance. I don't think so.
Yeah, well, I never, well, as on the record, I never liked this McGrath study. And also, if I want to point a certain position, I don't want to be, to be in front of the employee, that particular situation. But okay, but I got what you're saying. Thank you. But actually, I do question, are there any of this, because some of the name is not with the survey, is there a difference? Maybe back to Sandra, are there any this is just strictly on the cost of living and based on the recommendation, comparative recommendation from McGrath, right? There's no merit type of thing involved in there? Or-
Correct. There's no merit based on that.
Okay.
Commissioner Kenny?
Sorry. Thank you. Chief Hovis, I was curious if there's any new information either from Dr. McGrath or other change of circumstances that is incorporated into your recommendation here in the agenda bill to pass this salary schedule adjustment.
No, there's not. I said the recommended action says discussion at the top, and staff's recommendation from previous is the carryover from the previous agenda bill from 2021 for the commission to accept the McGrath survey from 2021. If they're asking about a specific change in conditions, meaning Dr. McGrath or the McGrath company, there's not, other than Dr. McGrath is moving into retirement. She's relocated in another time zone even farther away from us, and she will not be back here. From my perspective at South County Fire, 2 chiefs ago, we went down this with Miss McGrath and the company when Chief Stedman was here, and it's not a long-term solution, my perspective from for South County Fire. Director Hollenbeck and I have had some initial conversation with a more local company that has working with Snow 911, has worked with the city of Edmonds, and the city of Wynwood is thinking about using them as well. And we found another more local resource that we'd also like to talk to before we do anything. Hopefully I'm answering your question, Commissioner Kinney, but it's just pursuant to this. At some point, as the budget process, we'll talk about salary survey in the future and trying to make something sustainable and something that we can have presentation from someone that's available and not retired. So does that catch everything?
Yeah, I was curious if there's some change of circumstances from when we last talked about this on October 19th, and the board tabled this, and you were going to come back with more information in the new year. And it was my understanding that there would be perhaps a new consultant, and we would get more accurate information than we had last year. So that's why I was curious if there's nothing in the agenda bill. I haven't seen anything, but I wanted to ask if there was something, if I'm missing something, if something has changed, or if there's something else from Dr. McGrath or something that, but it sounds like that's not the case.
Very fair question. We reached out to Dr. McGrath, who said, well, I'm not coming back. I'm retiring. I'm moving from, I believe, Michigan to Virginia. And I don't have anything else to add. There's no more private sector information that she could provide or any updates. Obviously, that salary survey is dated, and there's going to be some of the things have changed in the comparables of the other 10 fire agencies that she used in that document. Working hard to connect with another company, and they've got it connect in their name, so I'll leave that name out, but some other vendors to look at that are sustainable. But in the conversations we've had, due to market volatility, the high rate of inflation right now, not knowing where the economy is going, and try to get the numbers, just like CFO Bothwell mentioned, you need to get into about August before you can even start doing something else to see what market conditions look like. So in the 2 contacts we've made, that's what they've said. If you're going to offer it up into your budget chief going into 2023, we need to do something in August before we'd even start. And before we go down that pathway, commissioners, we will bring that company recommendation forward to you so that you can meet them as well and make sure we're on the right track. Part of this is, and Commissioner Chan we'll know this from Snow 911 and now Commissioner Daniels, part of this is about salary philosophy as an agency, and it's also about the study of market conditions. And we need to have some time. So Commissioner Kenny, nothing else to add.
Okay. So I think we need to then talk a little bit about some of the oversights or inaccuracies from the McGrath study that we got last October 19th. And you and I went through them, and you made a number of concessions at that time about the problems with the McGrath study. So I guess I want to start that with looking at the well, I guess it wasn't but you knew about it, and Ms. Hollenbeck signed off on the contract for it. And in that contract dated, at least and I sent all these documents out early this afternoon, May 14, 2021. One of the things that Dr. McGrath was supposed to do was to talk about a compensation philosophy. And we never actually talked at the board about a compensation philosophy, whether we were looking at public sector only, private sector, public-private, and you acknowledged on October 19th that we hadn't talked at the board level about that, and we haven't talked about it since, have we?
Is correct, because as I stated then, this is a refresh of the previous salary survey as authorized by the board.
Okay. One of the things that I think it's item number, bullet point number 4. One of the things that Dr. McGrath was going to do was do a external market survey looking at both public and limited private entities. And then in, I think it's bullet point number 7, was going to use that external market data to integrate into the salary schedule ranges. And in the actual document that she produced from October 19th, there was no public sector other than fire entities or private sector analysis in there. And that's still correct, right?
Is correct. As was discussed before in the previous salary survey, that was also correct that not all the private sector responded, because private sector doesn't have to, and they're not, don't have to subject to public information requests. So just like now, Dr. McGrath was unable to produce that for those companies. And also some of our comparables that were public companies she wasn't able to get documentation from them as well. You are correct.
Right, but for her October 19, 2021 analysis that I was a little surprised that you didn't send that out to the board, that I had to send that out to the board to provide some background for what exactly we're working off of. It just deals with our fire comparables, the fire comparables agencies from our union contract. Is that right?
Correct. The public employees noted in the plan are the 10 comparables now the RFA has, correct, that are also used for our union negotiations.
Okay, but the employees that are covered by this salary survey include some uniformed employees, but include a lot of non-uniformed employees. And in the past, we have had salary surveys that have addressed both other public than fire agencies and private agencies. So as an example, what I sent out was the 2018 document from Dr. McGrath, where she did have private agencies in there. At page 8 of her 2018 document, she had Boeing, Premier Blue Cross, Providence. One of them didn't respond, but she also had public sector providers, government agencies, Edmonds School District, Everett Public Schools in there, in addition to the fire agencies. And do you, I take it you don't find it valuable to know what those either public sector or private sector agencies are doing with their HR director, with their IT director, with their receptionist, with job classifications that are similar across all of those agencies, is that not important information?
Commissioner Kinney and commissioners, I didn't write this, author it, neither did Director Hollenbeck, understandably, that I think information is always powerful. And you could have a circumstance where the new Edmonds School District decided that they wanted to get information from fire service agencies like the RFA to think about their salary survey and vice versa. And that certainly could be the case. Information is always good to have.
But she was able to get that in 2018. And then I also sent out today Cabot Dow's salary survey that was done for the Fire District 1 in 2015. And at page 4 of his document, he included a whole bunch of government agencies that he looked at comparables that were non-fire agencies, including City of Bellevue, Bothell, Edmonds, Everett, Kirkland, Linwood, Marysville, Mountlake Terrace, Olympia, Redmond, Renton, Snohomish County, and the state of Washington, in addition to fire agencies. There was a criticism at that time, I think actually Commissioner Chan raised the criticism that private sector companies were not included in there. He did a follow-up, a supplemental that I also sent out to the board, where at least using the Milliman Puget Sound data, some component of private sector salaries was included in there. So we have two prior evaluations, one from 2015, one from 2018. We've been doing these about every 3 years that have included both private sector and public sector non-fire analysis, but we don't have that from McGrath in 2021. Does that concern you at all, that the accuracy of the data may not be up to par?
Well, what I like is that both of the companies we talked to so far referenced McMillan too. And they also said, you know, private sector is hard to compare to, as I already mentioned. And I definitely think that some of those cities and those fire departments that you named that are comparables are good things to know. And certainly some of our contract cities like Mali Terrace. So to have the information is good. I will say Cabot Dow is local, and I'm not going to say how good his information is or isn't and how accurate or updated it is. But at that time, that's what District 1 wanted to do. And he's been a longtime resource for nearly 4 decades in this area. So he does have some good inroads into information. And one thing that I will make the observation for the record, it's very difficult to be a consultant that doesn't live in, you know, here in this area that's now retired to be able to get all this information. And a big difference with this as well is during the middle of a pandemic, some of these agencies, both private and public, didn't get us the information through Victoria, that McGrath, that we would have hoped to have done previously, like we had before when it wasn't a pandemic. So again, like you had mentioned, having information is good, right? And I agree with you. But at this point, we don't have that information. We can't go back to McGrath. The only thing that, as far as my opinion is we need to look forward. So bringing the information back at the request of the commission is what we did. And if I could get back into a time machine back to last year and try to get her to fill in all those blanks so everybody was satisfied, I wish we could go back there, but we can't.
Well, Chief Hovis, the data actually, I was a little surprised back on October 19th, 2021, that she didn't actually collect the data. Our staff collected the data. And then she, through some proprietary algorithm or other analysis that she does, she created the report. But she appeared in the 2018 one to perhaps have done more in terms of, because you referenced the fact that she's, I think, from Indiana, and I don't believe she came out here for this most recent report to do any analysis. She didn't come and talk to the board. She did in 2018. But since this report, I'm hoping you might concede there's been a change of circumstances, that inflation has increased quite a bit since October. The most recent data from the Bureau of Labor Statistics indicates that in April, CPIU is at 8.3%. That's the inflation rate. So inflation is significantly higher now than it was in October, wasn't it?
It was in the 8.5% CPIW April to April for Seattle, Bellevue, Tacoma, and the 9.1 for CPIU is historic. I will definitely agree with you on that. So it makes these the changes or the impacts to bring these employees that were outside of market, if the board wants to go there, in an even higher differential because of that change. So this is just looking forward into the future, but you're completely right. It's historic inflation right now. I agree with you.
Well, one other significant change of circumstances since the McGrath report, October 19, 2021, is that in December of 2021, the board finalized its deputy chief's contract, which has a relationship to the assistant chiefs and also perhaps to your salary, as those, although they are not, there's nothing contractually related. The fact that the deputy chief's contract settled in a particular manner, that it is related to the battalion chief's schedule, is something that may have an influence on the board as it might consider assistant chief and chief salaries. Is that fair? Is that something that's changed since? I mean, that hadn't happened in October, right?
Certainly hasn't changed, and Ms. McGrath was not part of those negotiations, as we all know, and that the presentation from Ms. McGrath was before the deputy chief contract was settled, and this salary survey is not related to the deputy chief negotiations with collective bargaining. But I will say that that has certainly been settled. We got to that point from January 2017 until that contract was settled, where they didn't have the deputy chief contract. So I take that back, August of 2017, when they were certified by PERC. So it was a long time, definitely, to get that done. I agree with you. but the assistant chiefs of the people listed on page 63 in the packet are not tied to the deputy chief contract that's been settled, but it has been settled. And I'll stop there.
Well, that's true, but the board in perhaps one analysis might want to consider the deputy chiefs, I'm not using the right term, but the consolidation, the compression between the deputy chiefs and the assistant chiefs, and the compression then with the chief, and how that relates to each other as they're considering that type of executive compensation or higher level compensation.
Internal compression is always, I think of something that people that do this work would consider internal wage compression. Sure, that's definitely terminology that.
Well, but clearly Dr. McGrath didn't have that information when she was creating this salary schedule in October, because it happened after it, which gets to the point that I'm trying to make, which is that there's a significant change of circumstances in terms of inflation and what's happened with the deputy chief's contract. The analysis was inaccurate at the time in terms of other public agencies that are government agencies. It only considered fire agencies, and it didn't consider any private sector. And so when you put in other public, I'm interested in what is the marketplace for these positions, for HR director, for IT director, for receptionist. What is the marketplace? What is the Edmond School District paying, and the city of Everett? Because I've got to compete locally for those people, but I'm also competing to some extent with the Boeings, with Providence, for some of those positions, not for assistant chiefs, but for receptionists and for HR directors. And private sector, maybe they pay more, maybe they pay less, maybe they've got less benefits, maybe they've got better benefits. I don't know, but those are the people that I'm competing, entities that I'm competing with. And I do want to be competitive. But my issue is we don't know based on this analysis, because it wasn't done. And it was done previously, so we know it can be done. It just wasn't done. And now we've got a bunch of changes, or a number of changes since then. So when we look at this schedule, how do we know that it's not too high? But how do we know that it's not too low, particularly with the inflation that's happening? So my issue is the inaccuracy of it. And what I can't quite figure out is why I understand why other people might want to pass this, but I don't understand why you are endorsing it, because I know you and I have spoken about it and spoken about the inaccuracies of it. And that's why I can't figure out why you are not bringing anything new to the table to say, yeah, let's not do this. Let's do a new analysis. Let's get a new consultant. Let's do this right based on a good information. We do this about once every 3 years. Let's do it right for our employees with accurate information. But this is inaccurate. So I can't support this because I don't know if it's too high. I don't know if it's too low. I know it doesn't consider the type of comparables that I want to know about. And nobody's really looked at the whole picture here. So that's where I have a problem with it. And you Ms. Hollenbeck in the contract on behalf of South County Fire asked for this information, the public-private information, and it wasn't provided. So we're making decisions based on not enough information, which is just bad decision-making.
Well, just kind of in summary, I always appreciate the input, and we had this conversation before with some of the board here and some of the new board. We have the best information that we have at the time. I didn't disagree with you on many points, Commissioner Kenny, that you made, and other commissioners supported you on, but it's the information that we have right now. And we were asked to bring this back, which we have done. And I guarantee you that my recommendation is not to bring back Cabot Dow. And my recommendation is not to bring back Victoria McGrath. And we will bring somebody back, but we can't do it now because none of them can engage in that work until they know market conditions. It is not in the budget that was approved by the board as well. And when I'll bring it back for consideration, will be included in the budget for development in 2023 with a salary philosophy that the commission at the time can talk about, and also something sustainable, and also something I hope in alignment with some of our external partners, like our current contract cities and those that have joined the RFA. And if we can get private sector information and public sector information to get a better look next time, then we will do so. And I'll carry that message to staff as they've already heard it, and carry it to the potential vendors as well.
So for myself, and we'll jump to Commissioner Chan next, This was a small subset of our employees that were set for a step increase. I'd like to point out that we've had 3 people that should have received that step increase that have left since the beginning of this year. There are 3 people that were omitted from that salary bump and to get them to market that have left. Whether they left because of that fact or not, I don't know. I don't know if that's been determined through exit interviews. But we've essentially taken staff and said, for 6 months, sorry, you don't get that pay bump, which puts you to market. Whether or not the public, private, all of that bears out. I tend to think that the public, the private sector is going to be probably paying a little bit better. But to your point, Commissioner Kenny, with the 8.3, 8.5% that we've seen, I highly doubt that any of these would be above or over where they should be, especially given that. I simply believe that we should do right by those employees, add the step increase that they should have gotten January 1st. And unfortunately, it's only going to come starting July 1st. And yes, do better in the next salary survey, find a better company, set better parameters, and use that moving forward. Commissioner Chan.
Yeah, well, again, I'm addressing the Commissioner. Kenny, I thank you for all the things, but I think the critical part, as we all know, we actually at that time, when Stackman bring in McGrath, the whole board did not like her at all. The one thing is that I think maybe Chief Hobart to take note on that, is that she was engaged with the staff only, and she came in, she thought she's serving the staff, not the commissioner. And remember that she basically disrespect the whole board. Oh, commissioner just one vote more than the other person. So I think the whole scenario is not good. And then I support you, Commissioner. Chief Overs, I think this would definitely, it was wrong with McGrath because not regional. And I want to emphasize, you even listening carefully in your own thing. Number one, we should engage someone more locally, and maybe they should really report to the commissioner, because the staff in here, you're involved in yourself too. I think it will be, it's very difficult for you to, with the administration staff, tell them, but no, not that. I think you should be independent, move on to commissioner can conduct that. I think that would shield you from that. And so Commissioner Kenny, I understand that. I do agree we have to move on right now. And I think it's not, I don't think it's Chief Hover's fault. It's really, and Stackman at that time was really kind of the thing. But I want to emphasize one thing. Right now, Sandra is come from a private industry, Seattle Times, okay? Chief, the IT person, I don't know, to me, administration are very not specific, right? It's not fire department receptionist. I just don't see a difference between a fire department receptionist versus a reception or dentist or that type of thing. So that's the people that we compete with. But those data are very, very easy to get. Puget Sound, if you go to any of the large recruitment office, you say, I want to hire a certain thing. I want to hire accountant, account payable. They can tell you the market and what you need to do, compete, especially locally. So I don't really need to do this fancy study from McGrath. We can get, every year I got those reports and I can share it with you, and just, you Google it. Government has a lot of things specific, Seattle area, Puget Sound area, what receptions called. So I would encourage you taking this, and I would agree with this. I would vote yes to this, not because I completely would have all the facts and everything else, but let's move forward. And I know that you and Sandra can do a good job and get commissioner involved as a report. Otherwise, the problem of the consultant is that if they think you're the one decision maker, they're trying to please you and not the commissioner. Commissioner can do a really independent way to rate, because actually commissioner is the one that who have the power of the budget, right? And that's the one that will get our commissioner to be pleased.
That is,
to-
yeah.
Yeah.
Correct. I don't want to cut you off, Commissioner Chan, but it is right to use a consultant isolates even HR Director Hollenbeck and her team, because there's only 3 contract employees in this organization. 2 of them are looking at you on this screen. The rest of everyone else is organized into a union. And that's one unique thing compared to other agencies that are out there, even other fire districts or RFAs or cities of public employees, that they get their own salary surveys done through AWC or through a collective bargaining process.
Right. No, IT person probably, I don't think there's a huge difference between the IT on that. Even our chief financial officer, he came from a city. He did not come from a fire department. Melissa, our executive secretary, she didn't come from a fire department. So it doesn't make sense for us to completely compare to that. So I think let's move on. Let's get an employee, but I do not want to blame the free employee left because we did not have a jump. I don't see a relation. I don't want to make a claim that because we did not make the approve, somebody left. I don't have the evidence. I would just let's vote yes and move on. Thank you.
Any other commissioner comments? All in favor, say aye.
Aye.
All opposed?
No.
Motion carries 6-1.
This next one's mine too, Chair Urban and Commissioners, if we want to get into it whenever you're ready.
Yep, moving on to 10D, resolution recognizing Juneteenth.
Okay, great. Well, we've talked about this, I think, at different times, understanding as our communities have changed at all of the areas of the Regional Fire Authority, and our county and our RFA is becoming more diverse, as well as our workforce. You'll notice on page 64, we have an agenda bill tonight for you commissioners to consider for action. Part of this discussion comes with the relationships we have with our contract cities and non-contract cities to talk about what they're doing to recognize Juneteenth as a paid holiday for our non-represented employees. As Commissioner Kenny just mentioned, our deputy chief's contract does represent Juneteenth. We're currently in negotiation with our other group of represented employees. And that is a consideration always about what are holidays, but we're still in those negotiation processes. Got a resolution on the next page. Sorry, I'm almost going to have to use readers every time here, commissioners, going forward. But we're on page 65, I believe, 66 with the resolution. Here's what it talks about. So we know at a federal level, President Biden has declared Juneteenth a federal holiday, and as well, Governor Inslee has for the state of Washington, as well as the County Council for Snohomish County and Executive Summers and the County Council. Digging in a little bit further, the city of Edmonds, Linwood, and Mount Lake Terrace, current contract cities, communities within South County Fire have also recognized Juneteenth as a holiday. We want to bring this in front of you today because this is a regular meeting where action could potentially take in. Juneteenth is typically June 19th. On this year, it falls on June 20th, and we don't meet again until the 21st. I know how much commissioners you've and we as an organization, and as we've changed from our legacy organization, South County Fire, have talked a lot about diversity, equity, inclusion. And we have changed a lot of what our employees compose our organization. I'm excited for you to meet the next 16 that just started. I'm excited for you to meet the next group in the Fall Academy, because I'm excited about how our organization is getting great people here that really embody not this resolution, but where we want to go as an organization. So with that, this is your discretion. The agenda bill is located, as well as this resolution, for your consideration to recognize Juneteenth as a paid holiday for non-represented employees. And with that, I will turn it over to Director Hollenbeck, who's on the agenda bill as well, helped work on this resolution, for any additional comments.
Thank you, Chief. I think you said that well. We understand that the board prefers to get information first and vote later, but we recognize the timeliness of this and just wanted to at least have the option for the board to potentially adopt this tonight if you choose. Certainly you don't have to, but we think this is an important, I think, step to take and supporting all of the aspects of where we're going culturally with this organization, as Chief Ho has just mentioned. So nothing more to add.
Commissioner Daniels?
I move to adopt resolution number 06072022-01. Excuse me, to add Juneteenth for administrative as a paid holiday beginning in 2022.
Have a second on the motion? Commissioner Rowland? Any discussion on the motion? Commissioner Chan?
Yeah, I wasn't comfortable, just, I mean, there's no discussion, no questions, and I thought we were able to ask some questions first. So how does other agency do? Are we, I just want to know, I mean, do you have any survey of what other agents do and other things in there, other company? I don't think too many private company would do that. So, and what would that impact to our financially? Or just because most of the work they have to done anyway, so it's not really no financial impact. We don't have high additional people. I think those are need to be really considered before we move on any of the gender. It seems to me we're so rushed on this. And then 16, well, I guess the problem is that we did not have another section before the June 16, because next session is we can make it a special meeting and make a decision on that. Can you?
Yeah, Commissioner Chan and commissioners, with the guidelines we previously stated about work sessions relegated to capital facilities, intergovernmental or financial aspects, we wanted to bring this forward to you today, like many other cities would do. We went to federal, state, county, and then just within the borders of the RFA is what we talked about as a staff. There is 2 cities, one we currently serve, Briar, one we will serve, Mill Creek, that have not yet passed resolutions. I can't speak for where their city manager, mayor, or council will be, but everything's just in the resolution itself, and your discretion, chair and commission, if you want to change the next meeting to a special meeting, but we want to stay within the guidelines and parameters I previously stated to focus on those 3 issues.
Yeah, but I think just as a practice, I think we need more information. Like, so do you know what's a financial impact to us, given additional holiday?
Yeah, this would be one less day at work for just our non-represented employees here at headquarters, the ones that aren't into a union. So essentially it would be the day off, meaning, they've 365 days in the year, approximately 208 work days. It would be one less day at work. So obviously I'm not part of this resolution. There will be still some of us that will be at work. There will be the firefighters that up into the ranks of battalion chief that aren't covered under this agreement that'll obviously still be at work. 911 calls will go to all those different things. This doesn't apply to me or Melissa Blankenship, I guess, from a technical standpoint, but just thought it was important to bring it back for the reasons I previously stated.
So this is non-uniform. So therefore, in a general, I'm just make a rationale in myself. So those people, when they're gone, nobody's doing their work anyway. So they can come back on the next day, they have to do work. So we are not really hiring additional staff or anything to do the work that they are. So
that is correct. So if this is passed, the deputy chiefs will have Juneteenth as a holiday currently under collective bargaining. That is intact. It would be your HQ administrative staff that would be here otherwise. If they weren't, but there's no backfill of overtime or those sort of things like we would have with our rank and file represented employees from battalion chief down to firefighter that respond to the 911 incidences.
So therefore, actually in the sense when it's a holiday, but it really not, they just stack up the work and that, I mean, it sounds like a holiday, but they still have to do work. Is that,
yes, sir.
Can I justify myself to say this is a no financial impact?
I think that in this discussion here, I think we just landed on that.
Yeah, well, in the future reference, my future, I think I would appreciate more that this come in more information, who does, who doesn't have, and are we in the trend, that type of thing, much easier for the decision. Were you able to get more information for next week, or is really you read?
We've talked to every, just federal, state, county, and every, all the contract cities plus Mill Creek have been queried on this. I don't know anybody else outside of the borders. I thought about Mukilteo, Everett, those sort of things, but we wanted to talk about the employees here at South County Fire, the residents within the RFA that we serve, those unincorporated areas, and then our contract cities and non-contract cities, with the focus on the resolution, Commissioner Chan. And, could have potentially brought this back the last meeting in May. I'll let the commissioners know this is something that our workforce has been talking about here at headquarters and the importance of this. It also, with you and I meeting on May 31st and talking about that the last day of that month, got me thinking about this. And then conversations with HR Director Hollenbeck and staff here at HQ, I want to bring forward as an advocate, not only for you as commissioners in the RFA and the public we serve, what other entities are doing. So that's why it's here today. It's your discretion if you want to take action, obviously, or to make this a special meeting item for next Tuesday. But that's what I got.
I think you just answered most of my questions, but my displeasure is that there's a big rush. But I will vote yes, because you just gave me the answer, because no financial impact to us. Thank you very much.
Commissioner Lawrence?
Yes, sir.
Yeah, hi, Chief. Yeah, I'd sure like to postpone this, get more information. I've heard this term bandied about. What is your definition of this holiday?
I think I wouldn't do it justice unless I read the proclamation, which was based on a lot of people before us, at the federal, state, and even the county level. But really, it's whereas Juneteenth is a day for us to reflect on the suffering caused by slavery, acknowledge the evils and hatred, discrimination, which I know we're all committed to not having here at South County Fire, and commit to being allies of our Black and African American friends, families, and neighbors. I think that third whereas, for me, captures a lot of what I think about Juneteenth.
Okay, yeah, I just was researching it here while everybody else was yammering away there. So yeah, it's an old holiday celebrated. It's a celebration of the end of slavery in Galveston, Texas, 1865. Interesting. So yeah, but I'd sure like to take the slow bell on this, but it's kind of dropped on us here.
Commissioner Daniels?
In the IT community, it's very common. The Microsoft, Google, Facebook, they all observe Juneteenth. So you're asking about the private sector, those large corporations all do it, including my employer also observes Juneteenth. So it's more common than maybe what you're familiar with.
And with the federal recognition, it's now bank holiday, and it's also one that we instituted at the chamber as far as a recognized federal holiday with time off. Any other questions, comments? So there's a motion and a second. All in favor of the motion? All opposed? Any abstentions? Motion carries 601.
Thank you,
Thank you, Chief.
Yeah, thank you, commissioners, and very good discussion. I appreciate explaining the why. So thank you.
Moving on to item 11A, Intergovernmental Ad Hoc Committee for Annexations with Eastman and Hovis.
Well, I'm about to lose my voice. I've been talking so much tonight, Commissioner, so I will try to keep this a little bit easier. I'm going to do a kind of a topical, and that it's strange to bring this back to you after recent discussions about committees. But I will say that the ask is, and this doesn't have to be done today necessarily, but it's an important thing we're going to have to get to. As you know, myself, Chief Eastman, many of the chiefs in this room, PIO Hines, CFO Bothwell, we've been working for a while as an RFA and a tandem with you commissioners to talk about things like our contract cities joining the RFA, and Mill Creek was a little bit of a left turn, and we dropped in the RFA's decision making on whether or not they were going to join our RFA. But the city, I want to make sure that I inform you that the city of Mount Lake Terrace has formed an RFA exploratory committee composed of 3 of their council members. That is discussed in the packet on page 68. Additionally, the city of Briar has not gotten there yet, but Mayor Kamenik and staff are also evaluating that, and their council is asking really good questions. So as a reminder, on January 18th of 2025, we will have 2 contract cities under contract. By January 19th of 2025, we wouldn't, for the initial 20-year terms of those agreements will have ended unless we give a formal 2-year notice at 2 years before that date and engage in conversations with the elected officials from Mount Lake Terrace and Briar. We've got 3 council members from Mount Lake Terrace, 2 of which were on the RFA planning committee before, one of which that voted on the original agreement with Mount Lake Terrace in District 1 to contract for that 20 years. And a newer council member that are part of that team to support City Manager Hugel and staff to get to the point where we're going to talk about Mount Lake Terrace doing something different than a contract or joining an RFA. So in conversation with City Manager Hugel, he suggested that and I agree with him, bring that to your attention at some point here in the near future. We'll most likely need to have some sort of a commission group to interact with those 3 council members. Don't have a date for you yet, but it is coming. And our hope would be that just like Mill Creek, that hopefully maybe April, as early as April 2023, have something could be on the special election ballot, but that's going to be up to the city of Mount Lake Terrace and all of the work and discussions that happen in the meantime. City of Briar, that could be the hope as well, but we're just not quite there as far along yet. So really that's where we're at. Chief Eastman, anything else to add?
I do not, Chief.
Okay, that's what we have for tonight. And again, I can't say that any meeting dates, when they're going to happen and all those things, but that 3-person council group has met at least 3 times that I'm aware of. They're working with City Manager Hugel. They are reporting back to their 7-person council, or will be in the future. And they're thinking about us, and just wanted to bring that to the commission's attention to start thinking about what we would want to do.
Thank you, Chief.
Thank you.
It seems like a good topic or a good discussion next week in our work session to kind of flush out that notion, that idea, and kind of what we need to start preparing on our side, and potentially form that ad hoc committee at our 3rd meeting this month, and then figure out as far as commissioner placement. Commissioner Lawrence?
Yeah, I agree. Let's talk about it next week. And hopefully we can end this evening, like right now.
Mr. Chan?
Yeah, did you say, Chief Howard, did you say you sent the formal letter or you haven't sent it yet?
Haven't, no, haven't. We have not, as an RFA, sent anything. When that happens, we'll have to have the, legal review and commission, and you guys have that discussion. What I sent about 3 years out is a reminder to City Manager Hugel and Mayor Kamenik that we need to start having these discussions to lay the groundwork or foundation to get to this point in time. So no formal notification of the 2 years has been given to Briar, Terrace, Edmonds, anything. So I just want to make that clear. Good question.
Yeah, no, I thought Commissioner Matter had a recollection. He thought that you sent it already. No, okay, it hasn't. So here's a question for Commissioner Kenny. Were you the one that signed the Mount Lake Terrace agreement? Are you at least the discussion? Are you involved in that?
The contract, you mean?
The contract, yeah.
Yeah, I passed and signed the contract when I was on the board. Yeah.
Okay, so I would think appropriate for you to be on that committee because of original intents and all this stuff, and give us a little background. And during on the opening day, I did talk to Scott, and he asked what is the feeling of the commissioner, and I said, yeah, they should be for it, and And I think it's a good idea. Thank you for bringing this up. I think we need 3 commissioners to engage, and I would recommend that Commissioner Kennedy should be one of them because he knows the people. And I'm also interested in that too. Yeah. Because a lot of relationship we have with monitors during the 2 RFA talk.
Any other questions, comments on this topic? All right, we'll add it to the topic for next week and kind of get further into the discussions. Item 11B. So as most of you are aware, I will be departing. I have a plan to relocate out of state this July. My daughter and I departing, moving back to Northern Illinois where I grew up. There's an opportunity to purchase a lakeside resort with siblings adjacent to a family property that also has a resort run by my sister. So it's been great out here. Just time for my daughter, who's turning 6 this month, to have a little bit more access to family and kind of a bit of a change of pace. So with that, I'll put in my formal resignation letter. I'm currently targeting July 5th as my last meeting, right after the 4th of July, which I'm trying to stick through here, make sure that the chamber and our 4th of July event goes smoothly. And the chamber's working on a transition of a new CEO and looking to hire for that right now. So with that, our typical process of a vacancy would be to start, put the advertisements out for applicants for District 2 to be able to start taking applications, hopefully for 3 to 4 weeks, to give enough time, get it out there. And then the commission, of course, would interview and appoint someone to fill my vacancy pretty much anytime after the 5th. So I guess we just kind of need to be able to direct staff to start that advertisement, start collecting applications, and push to the commissioners if you know somebody that is within the District 2 bounds to encourage them to apply. Any questions, comments, thoughts? Commissioner Rowland?
I just wanted to say we didn't get a long time to work together. I want to wish you the best going back to Northern Illinois. Give me the information on the resort because my family also lives in Northern Illinois, so maybe I'll swing by and see how you're doing.
Great, yeah. I look forward to getting back to being able to do the fishing, boating. I haven't gone fishing in like 3 or 4 years. I've been too swamped and too busy, and I think it'll be a nice rechange of pace. But yeah, I'll keep everybody informed of where everything's landing and where I'll be. Coach Teoflak.
I was trying to think about logistics of how long of the deadline for applications, I guess. And I'm okay with a 4-week process, starting from the first time of advertising. I don't know how long it takes to put something in a paper or online. So I don't know if July 15th is a good application date. So there would be some meetings where it's just 6 of us.
I mean, I get the notion of trying to keep it out there for a long time. Thinking of the budgetary process and bringing a new commissioner in, it might be nice to try to get the applicants in ahead of time, and maybe by the end of June, so that there's the possibility of seating somebody on the 12th. I know it'd be a trial by fire, having the first meeting be a big budgetary discussion, but definitely an important thing for somebody to kind of jump in and start being exposed to.
Yeah, I'd be happy to hear what other commissioners think.
Commissioner Daniels?
I agree with Vice Chair Teoflak that we should get going on it sooner than later. And yeah, trial by fire for the budget process is a pretty accurate statement. I would be interested to see what the timeline would be to basically copy what was put out there for District 4 and how we got Micah, and then start collecting applications.
I know from past experience, Leslie Hines has all that stuff, and the Facebook and online posting stuff could pretty much take place immediately. Getting stuff into the Herald and other venues might take a couple days at most, but replugging that back into the Fire Commission website and under the commissioner page wouldn't take too long either. And then it's just a matter of the commissioners and people within the RFA that are aware of it to reach out into the community of people that they know and see if there's any good candidates that should apply. Chief?
Happy to meet and talk with PIO Hines and Melissa Blankenship tomorrow to get that started, whatever the board decides on.
Yeah, let's get it started.
Commissioner Geo Flack?
I think in the advertisements, we should have a deadline date. So I feel like we need to make a decision on that. And Director Hollenbeck, I just wanted to get kind of maybe your professional opinion if the end of the month sounds just professionally from you like a, what's the term I want to use? Not like ethically or morally, but it just, does it make sense or is it too quick?
Reasonableness.
Yeah.
Yeah, I think it's quick, but I don't think it's unreasonable.
I think the one difficulty is that if it goes another week, it's overlapping into the 4th of July, which, is going to hit people focused on something else. I think if you can give them that end of the month deadline, it might spur them to apply faster. And it could always be extended if no applicants are received. I know we had very delayed applicants the last time we did this. It was nothing, and then all of a sudden we had 2 or 3 at the end. So Commissioner Chan?
Oh, I think also the weekend approach is not hiring employees. So I think we do need a little bit longer time for people to solicit them because nobody will look at the warrant ad to see a commission is available. So, and then I think commission our executive assistant Melissa had done that last time, right, Melissa? Yeah, I think, yeah.
I would point out that pretty much most of the applicants that we've received in the last 2 times we've done this have all been from referrals of other commissioners or staff contacts. I don't think we've gotten anybody that was just general, never knew anything about the Fire Commission or anybody within it. I don't think we've had just a general nobody that kind of said, hey, I want to do that.
Right, but I do think advertising and maybe improve a little bit, so we can have more exposure.
Melissa?
Do you want to take Commissioner Rowland first? He had his hand up.
I thought you were responding to what Commissioner Chan had
Well,
requested.
I was going to make a quick comment that we need to take into consideration that we'll be, with the city of Mill Creek coming on board, we're going to be redistricting. So that process has started, and there's potentially each of the districts will adjust slightly. So, and the official date of Mill Creek's inclusion is August 1st. So I wanted the board to keep all of that in mind as well.
So get somebody before it potentially changes, or wait until it's changed.
Rich, would you like to speak to this based on our conversation today?
Well, the thing that I would say is if you select someone who ends up being outside the revised District 2, then when that redistricting takes effect, they would be ineligible to continue serving as a commissioner. We've talked about the redistricting before. It needs to be done prior to the filing period for that position in 2023. But it would be ideal if you did select someone who, would be in, we don't know what that redistricted position is going to look like yet, but that is a risk, is that if you select somebody now And it turns out that they are on the margins of District 2 and wind up not being in District 2 after the redistricting is done. They would be ineligible to serve. So that's the law.
But traditionally in the redistricting, don't they take the existing commissioners and their locations and take that into, they take that as a factor in how they redraw?
That's certainly a factor that is taken into account. But you'd have to ask, I forget his name, with Sammamish data, you have to ask him kind of the details, how he goes about his business.
Okay, Commissioner Rowland?
Well, if we did it if we tried to push for the end of the month, that's 2.5 weeks effectively. Once we get everything out and people are aware of it, that does seem very fast.
Yeah.
I do understand the need to try to get somebody in and get them involved in the budget process. But even if we get somebody in, unless they're watching every single meeting beforehand, and hopefully we get a candidate like that, they won't be up to speed to really participate in a meaningful way. And if they are, an applicant and they're watching the meetings as we go through that, they're going to gain pretty much about the same amount of information out of it as they would if they were seated already. So I don't think holding off until, like giving a good 4 weeks isn't bad for us, I don't think.
Commissioner Kenny?
Well, I think Chris and Micah are closer to where I think the realistic mark is, which is need about a month. It's already June 7th. We need our staff an opportunity to get going on the marketing piece to it, so to speak. If you figure that gets started middle of next week, the 15th of June, give it a month to July 15, somewhere about there and that gets you beyond the 4th of July holiday. As a deadline, and then plan for interviews sometime the last 2 weeks of July, because you might need 2 interview dates. I know we only needed 1 this last time, but in other years, we've done 2 to accommodate candidates. That might be more realistic to get that month's worth of time or so, but also get beyond the holiday and an opportunity for not be too rushed for folks to apply, because I think if I'm remembering right, we only had 3 candidates this past time, which is good, don't get me wrong, but we've had more in the past. And more is it's always nice to select from a 3 was good, don't get me wrong, but it's always nice to have more. And I will note that one of our candidates, I recall, he said that he found out about it from the yard sign in front of Station 11. So, those old methods of advertising sometimes work to bring in candidates. And so we need an opportunity for those things to work. So that's just my thoughts.
Well, it sounds like that's general consensus. So is that enough direction for staff? Great. We're wishing you luck that you get a great candidate that can add to the conversation and collective knowledge of the commission. Commissioner Chan?
Yeah, actually, are we done with this, or I just some
I was going to move on
before the meeting?
I was going to move on to commissioner comments.
Oh, actually, so my question, I have so many notes on my thing, I forgot. Maybe Sandra, Chris, the new IT manager, does he has a increase, or that was that is the offer that we sent it to, the amount $10,921.
Yeah, no, Commissioner, good question. What that does, so when we hired him, he was paid on the old schedule because the new schedule changes had not been adopted. So what this does is it gets him into the next closest pay step of the adjusted schedule. So what the commission voted for tonight was not just these pay increases for the individual people, but adjusting the schedule to match the market. So this is getting each person whose schedule changed into the next closest step of that revised schedule. I don't know if that makes sense, but
yeah, it does not make sense, because the person here, boom, he got an increase right away.
Yeah, because so what this does is it gets him into one of the defined steps in the pay schedule. And right now he's not one.
Okay, it does not make sense. Now maybe can vote like Kenny did. So maybe I should vote no on that, but it does not make sense to me, really. because I thought when you make an offer and that's it, you don't get increase or adjustment until was necessary. Is
Well,
that,
again, normally that
are we
wouldn't,
required to do that? Or we just say, no, that's your salary, that's your offer? You know, is that, I don't know.
we've been committed to, and our policy dictates that we pay people according to the salary schedule that's been adopted by the board. And so what that means is they need to be in one of the defined steps within that schedule. He was hired into the position that at the time the schedule dictated was the appropriate step. But now that we've changed the schedule with the adoption of what happened earlier tonight, he's now no longer in one of those steps. This just gets him to the next closest one.
Well, it proved me two things. Number one, the market, we're at the market rate because somebody, I assume it's not only him apply, right? There's a few more other people. How many applicants do we have on IT manager situations?
I'm sorry, I didn't hear your question.
Okay, how many people have applied for their positions?
Oh gosh, you know what, Commissioner, we've had so many positions open. I'm not sure I could tell
No,
you.
IT manager.
Yeah, I know, I
Very-
understand. I'm
very-
not
yeah,
sure I
I
know. I want to say roughly, I don't know. Chief, do you remember?
Very few as compared to a lot of other positions. And I don't want to get into the details of that, just specific to the new employee in this recorded meeting. But I will say that market considerations for these positions that we are difficult to fill and are extremely pivotal in our organization, especially losing Mike V, it was a factor in our recruitment and in our process for conditional offers and onboarding.
Okay, well, all right.
Commissioner Rowland?
As a veteran of the IT industry, I will say that our we have a rate that I mean there's a lot of money to be made in IT, so it's important to stay competitive in it. And to kind of alleviate your concerns, Commissioner Chan, just looking at those numbers, I think it's $1.50 an hour for that particular position difference. It's nothing huge. So in the grand scheme of things, so
I guess I'm a process man. It does not make sense on that. So Commissioner Kenny won that argument. All right.
Any additional commissioner comments?
Oh, okay. One more.
Go ahead, Commissioner Chen.
I think it's for because I'm in the law and doesn't want to do it be longer. I would talk my experience on the seminar and put it, but also I want to thank Chief Hovis and the crew. We did have, I was interviewed by Asian American televisions. At the beginning was talk about me, they said leaders, because I was involved in the community and I was being chosen as a leader of the Chinese community, Asian community, and also being one of the accomplished CPA, whatever. I don't know how they got it, but eventually we changed the theme to be coming and filming the training of the new recruit, and it was, I think it would give us a real exposure. After all, we have 20-some% Asians in our community, 20% of customers. So if it is a private business, I would try to really focus on that, and they are our customers, so to speak. So I really thank Chief Hovis and the crew and the training and accommodate that filming. The film crew just really happy and really appreciate you.
Very welcome. Appreciate staff that was willingly stepped up on short notice, and first time I've been translated into Mandarin to the best of my knowledge.
Cantonese.
And Cantonese, sorry. Okay,
Right.
so I wasn't quite sure because of you both talking there. What was, I just smile, and I know you guys did a great job of representing South County Fire.
I thought you understand every single word. They said you're good. How can you get a young and handsome chief? I said, well, we're way to attract beautiful people.
Well, that is very, very kind. I think there was another chief that we might have stepped up and do next time, but yeah, no, thanks for the invite, and glad we could accommodate the request. Thank you.
Commissioner Daniels?
I just want to say thank you, Chief Hovis, for the opportunity to knock off a bucket list item I didn't realize existed in riding a helicopter this morning out of Arlington Airport.
Very last minute short notice, but there was a state mobilization drill that included federal, military, state, and county assets. Cool event. up at Arlington Airport, and glad some of you that were able to take time out of your day to participate. Very short notice, and so I look forward to finding out more of those events. It's great that we can be embedded as a resource and people reach out to us to get us to participate, even when it's outside our jurisdiction. Is good stuff. So thank you. Everyone, you're welcome.
I look forward to working with everybody over the next 3 meetings, and we'll do my best to reach out to the community to see if we can find a good candidate to take my spot. Chief Eastman, a quick question. I know in last month we were talking about the basement remodel, and I know some numbers were being sought. Do you think we'll have those for our next meeting? We can talk under cap facilities. Because I know
To be
that's
honest,
a big item.
you know, Chief Isotel and myself and the facilities group is meeting with the architect TCA sometime in the very near future. I haven't seen the meeting date show up on my calendar yet. I would hope we'd be able to give you at least a ballpark when we get to the meeting Tuesday night. I won't know though until we get that meeting scheduled with TCA. So we're actively working to make that happen. I don't know if we'll make Tuesday night or not. We wanted to do the meeting before the end of the week, and there may have been conflicts with making sure that the team on the RFA side and the team on TCA has everybody available. So I'll keep Chief in the loop so he can discuss that with you at the end of the week as you guys are setting the agenda.
Okay, well, a robust discussion next week, and if we've got a close ballpark number by then to discuss and kind of banty about, if it's more of a hard number by the 3rd meeting, maybe that gives us a chance to actually start moving forward, so we don't annoy the county fire marshal too much into the year.
Yeah, I know, and Chief Isel, I don't want to steal any of your thunder, but I know in talking to TCA as we were setting up the conversation to meet, I know that they've got things ready. They got the permit package almost ready to go to the county. So we are at a spot where once we have this meeting with TCA and get back and be able to get back to the board, I think we're in a position to be able to launch quickly thereafter once staff is familiar with everything they got going and what the total dollars and cents are, and bring that back to the board. And we'll be in a position that when that happens, we'll be able to execute permitting and all that shortly thereafter.
Great. Anything else for commissioner comments? All right. Well, it is 10:01 and we'll adjourn for the evening. Look forward to seeing you back here next Tuesday for our work session. Have a good night.
Good night.
Good night. Thanks, commissioners.